Good morning again, everyone. I'm Cheryl Larson with Midwest Business Group on Health, and we're so excited to have you with us on this beautiful Wednesday morning in downtown Chicago. The sun is shining. It's going to be in the 40s today? Unheard of. Looking forward to it. Yep, exactly. You could clap for yourself. It's all good. We have got a fantastic day planned. We encourage you to network with each other. We hope that you learn from each other. We'll have plenty of time for exhibit hall time. We've got prizes, and for the next 15 minutes, I'm going to briefly take you through a number of important items. And let's get started with every speaker has to share a picture of what powers them up and gives them energy. This is my granddaughter, Faye. She will be 3 in March. She's my best buddy and an absolute terror. She really does give me energy, and she never stops moving. She sings a lot. She's defiant, and she's sweet as she can be. I also have a 12-year-old grandson who is my daughter's partner son, and he's moody, and we'll just leave it at that. Okay. We are so excited to share a little bit about MBGH. If you don't know who we are, we're one of the oldest and largest employer coalition of health benefits professionals in the country. What we're known for are our educational programs, and we've got a lot of people in this room. I would say about a third of you maybe I haven't seen before. So we're thrilled to have you here. And don't hesitate to come up to me or any of the staff members and ask questions. We are a trusted source. We are also pretty transparent. We're going to tell you who's supporting you in the marketplace and our views and opinions based on the research we do. We're going to tell you who's not supporting you. And this is the only employer-only event we have every year. And the only non-employers in this room are the people who sponsored it. And if we didn't have our sponsors, we couldn't have a wonderful events like this in places like this. So if you're an employer, these are the key areas that we can support your efforts. Educational programs. We have monthly educational programs, either in person or via webinar. Monthly employer-only roundtables. Those are only 1 hour right around lunchtime. They're virtual. The monthly educational programs like this are in person. The webinars are obviously virtual. Employer-only roundtables virtual. We also conduct frequent employer advisory boards to get a sense of what your challenges and opportunities in the marketplace are. We offer a social media platform called Employer Connect that gives you real-time information. My favorite part of Employer Connect is that you can submit any kind of a question related to what you're trying to do and get answers immediately or within a few days. Email updates, if you'd like to add anybody from your team, colleagues to our emails, here's information. And then finally, we do benchmarking surveys, and we just launched the results of our annual employer health priority survey. I'm going to share a few slides on that. But if any of you had a really important topic and you wanted a different way of reaching out other than Employer Connect, we can send out a benchmarking survey if you're a member and see staff. Here are our upcoming educational programs in person. We've got a program, not in person, excuse me, March 4th webinar on CGM, continuous glucose monitoring technology, and where we're at today on that. March 18th, we have another webinar on how employers can improve vaccine confidence with some simple action steps. March 26th is our next in-person program, our mental health forum, always a really excellent program. April 10th, we have a webinar on the improved adoption of biosimilars by Employers Matter and the cost savings that come with that. June 25th, we have our employer forum on pharmacy benefits, specialty drugs, and biopharma therapies. Very transparent program telling you what's really going on in the market and what you can do about it to preserve your revenue. And then on September 24th, tackling the chronic condition trifecta of cardiovascular, diabetes, and obesity. There'll be a smattering of other things in there as well. Our next employer-only roundtable, and we just conducted one a few weeks ago. We had one of my sister coalitions who's a legislator expert, and he was able to talk a little bit with us about what's going to change with the new administration. And we've been seeing some of that over the last week. Our next with our corporate medical director, Dr. Jan Berger, on optimizing drug formularies for better care and cost. And again, usually we'll have a speaker at these virtual roundtables for employers only. And then the rest of it will be interactive, asking you what you're doing, having you share and ask questions. Our 45th annual conference. Yes, that's how old we are. Just a quick reminder, if you haven't registered, early bird expires tomorrow, or is it Friday? Early bird expires Friday. Look at this fabulous theme, illusion versus reality, achieving truth, trust, and transparency in healthcare and benefits. Never more important as employers are fiduciaries. Also on the day before the conference starts on the 6th and 7th, on May 5th, we'll have an employer-only pre-conference on women's health. And it's not just the traditional women's health thing that we hear about. This is really digging down into the inequality and what we can do about it from a benefits parity perspective. We also are going to visit the Museum of Illusion, which is very excited, and have a dinner together. If you are, notice the little POW sign on the far right. If you're a member, every organization gets one full comp pass to the conference. If you're not an MBGH member, see Mark in the back. Mark, wave your hand. He may be able to hook you up with a complimentary or a very, very, very low cost pass. We'd love to have you join us. If you think these monthly events are great, our annual conference is wonderful. Here are some of our keynotes. Lynn from Edelman is going to talk about employers and trust and where we are at today. Our chair, Sherry Samuels First from Sargento Foods, is going to be talking about all of the initiatives she's done that have been very low cost and very effective. We have Rachel Hall, who's going to talk about truth, trust, and transparency throughout the continuum. We have Mandy O'Neill, who's going to, I don't know what Mandy's talking about. I could pretend I do, but I can't think of it right now. And the same, our other employer is Lockheed Martin. So we've got some pretty powerful speakers at this event. MBGH does office a purchasing division, and we never wanted to go in this direction, but there were certain products and services that our members kept asking us about. So we're able to get discounts and lower costs for collectively doing this through the purchasing marketplace. You can see the vendors that are part of that below, and you can talk to Mark if you have questions about that. Let's quickly walk through some of the survey results. And by the way, we did this for the first time this year with the National Alliance of Healthcare Purchaser Coalitions. They are another nonprofit like us that we helped to found that has about 40 employer coalitions from across the country. So there were a lot of lives that responded to this survey. The results you're going to see today are from our members, but employers across the country have similar views and perspectives. So let's start with, and this is a little small for me, what are employer perspectives on managing costs? I brought this survey up because we see 93% of you are saying rising healthcare costs will impact competitiveness. 90% say health and wellness benefits will play a crucial role in employee attraction and retention. And we all know attraction and retention has been absolutely key to the strategies you guys are implementing these days. And then 88% rising healthcare costs will lead to cost shifting for employees. And that quote at the bottom, I made sure we included in that. It's not just about cost control anymore. It's about survival. These are dicey times. Throw fiduciary in there, and we'll be having some people, a few people may reference it today, but some upcoming workshops on fiduciary to truly understand what you need to do. Our next slide, strategies employers are using to mitigate high-cost claims. You'll see on the far right, 67% of you are offering disease-specific vendors. 61% are offering enhanced screening and early detection programs, and 58% navigator or enhanced care case management. Top strategies being considered at the bottom, you can see promoting precision medicine for cancer treatment and centers of excellence and bundles. In terms of mental health, 75% of you are offering different programs, evaluating and promoting culture, competency, and diversity. Yes, yay. Keep doing that. Let's not let the government tell us what programs we can offer that are so critical to our populations. Integrating behavioral health. And then on the women's health side, parental leave, maternity support, and reproductive health. There's so many other areas that we can focus on in women's health. So I hope you can join us on May 5th. Here are some top obesity management strategies. And this whole presentation will be on your app, which I'm going to talk about in a second. And I'm going to go a little quicker because I have 4 minutes. Employers are increasingly supportive of policy reforms that can improve in transparency and fair pricing. As you know, we did a significant hospital fair price initiative in 2024, and that came up as number one, and we are heavily involved in PBM reform as well, and you can see those two, and we'll talk more about that in June. So let's talk about today's program. Please make sure your cell phones are off. Please make sure that you ask questions. We will have people walking around with microphones, and Paula will be helping. We have how many? About 50 people on the phone today? Okay, participating virtually. I love it. And those of you on the virtual, make sure that you ask questions of the speakers using the chat function. You can communicate with other virtual attendees. Let us know of any technical staff issues, etc. Here's the Wi-Fi password, and then we will have a brief evaluation at the end of the program. This is an HRCI accredited program. They have just connected with SHRM. So if you do get SHRM credits, see staff about how to connect the two, HRCI and SHRM. Here's MBGH's team. If you haven't met them, please introduce yourself. We're so glad to have you here. I want to thank the sponsors. Again, without them, we wouldn't be in this beautiful room eating this good food. Hinge Health, Lives, and Trestle Tree, exhibitors and resource sponsors. We love our prize drawing. So this month, look at these fabulous prizes. So that means that if you can visit, we're going to look at the prize card. Let's see. Do they have to do each one? Okay, so visit all of these guys. They'll initial your card, submit it at the registration desk. For those folks on the phone, there are other processes in place that Paula will make sure you're aware of. You must be present to win. We end at 4:15. Turn in your completed card by 2:25. Any questions on the prize drawing? I want the $500 gift card is what I want, but I'm not eligible. Okay, now we would like to share a word from one of our sponsors.
At Hinge Health, we're transforming the way pain is treated through the power of movement, technology, and human connection. Each member will work with a dedicated clinical care team that they can meet or message with in the Hinge Health app. Because everyone's path towards healing and pain management is different, each member gets a personalized playlist in the app. Members have access to a variety of true motion guided exercises, along with pain tracking and short educational articles. True Motion technology uses the camera of a member's personal device to track multiple body parts all at once, including small joints. It can also give real-time feedback, which helps members stay engaged and build confidence as they move. Guided exercises can be done anytime and anywhere, with no additional hardware required beyond a phone or tablet. Our program not only improves members' quality of life, it also saves money on unnecessary surgeries, prescriptions, and other medical costs.
Thank you, Hinge Health. Okay, get your phone. If you don't already have them out, because we love to do polling at our programs. And it also will show you where the agenda is, where the PowerPoint presentations are, et cetera. So you'll see the QR codes on the far left. You're going to want to follow the prompts. We have staff walking around to check and see if they can help. Click on the icon in the top right corner to confirm you're signed in if you haven't signed in. If you haven't downloaded the app yet, it's going to send you a key code. Verify you're in today's event, because I know every time I open mine, it's still on the event from the past event, which might have been a month ago. It might have been 3 months ago. And if you're having difficulty, you can click on more at the bottom right. Any other questions? If you have questions or if you need help, just raise your hand. We're going to talk very briefly about the polling questions, and then we're going to have a sample polling question and then a real polling question. So all can participate in this, both of you in the room and on the phone. What you're going to want to do, again, as a reminder, once you have it downloaded, is click on the home icon at the left of the app. If you don't see this program, click more again and select today's event, the January event. Click on the polling tile and then go ahead and answer that first poll when I set it up. Okay, here's the first question. This is the sample question, and we hope that you all answer it. Do we need another minute? Yeah, we're going to go one more minute so everybody can get on board. Raise your hand if you have questions or need help. Okay, are we ready to get started? All right. What well-being superpower would you choose to possess? You got 5 options: endless youthful energy and health of a child, the power to read anyone's mood, the gift to fall asleep by thinking, sleep now, the power to create more hours in your day, or the ability to teleport to your favorite outdoor spot. So go ahead and submit. I think we all need some energy. I know I do. Okay, I'm going to call it. Almost 50% of you want endless youthful energy in the health of a child. That's fantastic. And now we're going to have another word from one of our sponsors, Trestle Tree.
Trestle Tree is here to help you in your struggle to live a healthier and happier life.
Pushing education doesn't work. Everyone has a different story, and everyone is at a different stage of change.
You sort of hit that plateau mentally and physically. And sometimes it's good to hear from people that can help you think of things in another way.
I think a lot of our members have a good understanding of their health, but the implementation is the hard part.
It felt sort of like a mental health thing too, because she would just let me describe my journey with my health, and it would help me like really put everything on the table for myself.
There is a strong connection between our mental and physical health. Life is messy. Health is messy. Trestle Tree knows how to help you change your health and well-being. Your very own psychologist-trained Trestle Tree coach is your place to start your journey back.
Always keep pushing, because it's about you, it's about your health. You can't give up.
To see them progressing and to see that they are happy and they have hope. They have hope.
Thank you, Trestle Tree. Health care is messy. Let's just go with that. All right, our next polling question. How much time do you spend in nature each week? Be honest. Because we don't know who's responding to this. So it's confidential. So it looks like we are at almost 50% again, 1 to 5 hours. That's good. That's really good. So before I introduce our first speaker, I want to share a few reminders. Both our opening speaker today, Dr. Campbell, who I'll introduce in a moment, and our closing speaker, Alexandra Drain. And Alex, where are you? Did I say Drain correct? Oh my gosh, thank goodness. They are unable to share their slides, so please make any notes that you want. And they are both providing one-page summaries for us. So we're very grateful for that. That will include additional resources. The Nature of Wellness, How Time Outside Creates a Better Inside. We are thrilled to have Dr. Mark Campbell with us today. He is the owner and chief performance officer for Campbell Performance and the host of the podcast, Nature of Wellness. Mark has developed and delivered performance and wellness programs for the U.S. Army, the Department of Defense, and 14 other national military governments. He is a TEDx speaker and contributing author for mindful.org. He is also on several wellness advisory boards and speaks internationally. Mark's fun power-up photo, which you can see right here, shows he's on a hike with his dog, and you'll hear more about that. Thanks for joining us today, Mark. Appreciate it.
Hello, everyone. My name is Paula Sheehan. I'm the Director of Member Engagement here at MBGH. Thank you, Dr. Campbell. We are going to recognize another sponsor. Without our sponsors, we wouldn't be able to have events like this. So here is a word from Lives.
Imagine a world where every employee is able to prevent and detect 85% of diseases early. This is what we do at Lives, a comprehensive prevention platform designed to reduce the employer's major claims and close care gaps. Lives transforms every cell phone into a screening device, making prevention easy for all, including more than 10 mobile screenings, as easy as taking a selfie. Lives schedules every employee's required screenings with in-network providers. And it also connects them to their employer's benefits. An automated, personalized prevention platform that supports more than 120 screenings and vaccines, saving the employer between $6 to $13.5 million annually.
Thank you. If you want to get your phones out. So, one more question as I bring up our next speaker. Do you include stakeholders outside of your well-being team in your decision-making process? So are you including your leaders? Are you including wellness champions, employees, users of the program? All right, looks like we're doing pretty good. I think we know this. However, Jesse is going to come up and review, some highlights of how we can make sure that we're including those key stakeholders outside of our own program. Jesse serves as a well-being officer for Baylor College of Medicine. Since implementing their well-being initiative in 2014, they've won numerous awards, including the WellCOA Well Workplace Award, the C. Everett Koop Award. Jesse's pursuing a doctorate in public health, and the next time we'll see him, he'll probably be Dr. Gavin. In addition, next slide here, we've got Jesse's power up photo, and you can see he's definitely powering up. And last night at our speaker dinner, we heard he's also a fan of the cold baths. So cold is not, a barrier for Dr. Gavin almost. Welcome, Jesse. Thank you.
Thank you so much. Sis. Thank you so much for the Midwest Business Group on Health for inviting me out today. This right here. So again, I like the cold plunge. That gives me energy. As you see here, I also do CrossFit. I coach CrossFit just for fun. And as you know, number one rule in CrossFit is you have to tell as many people that you do CrossFit as possible. So there's 50 people here, 50 people online. So I'm good for a while. So that's a really good thing. Also, as you know, just to let you know, Baylor College of Medicine is in the Texas Medical Center in Houston. It is not Baylor Waco. I know a lot of people come up to me and say, yeah, Baylor Bears. It's not the same thing. And so it did break apart in '69. We got adopted by the Texas Medical Center. We have about 13,000 employees, about 1,800 students that are able to participate in our plan. So A part of that poll, what we want to talk about today, I'm going to talk really about a part 1 and a part 2. Part 1, we're really going to talk about the history, the research. Of course, to understand where we want to go, we have to know where we've been. And so we're going to talk about the why this is important. But then we're going to talk about how to apply it. There's a worksheet on everyone's table that we're going to go through, because my real intention is for everyone to, once we grasp this information, for you to actually apply it into your organization and for you to have a framework to take back with you after today. Okay? So really, we'll talk about how to understand the importance and value of key stakeholders, again, the why, and then also identify who those stakeholders are, the assets that we have available to us, and then how to apply these key learnings into a project, a resource, an initiative that you're trying to implement into your organization. I saw in the poll before the session that a lot of people jumped on it. They're like, yeah, I am a yes on this one. And then the no started to trickle on, or maybe I don't do that. And so that percentage started to come down a little bit. So one of the reasons why it's so important to include as many people as possible in what we do is kind of what Dr. Mark Campbell just talked about. We don't like being told what to do. And really, in healthcare, in well-being specifically, what is our main role? To tell people what to do, right? And if you get people that are kind of steadfast in their ways, you're going to have a lot of resistance. I was health coaching an individual in a manufacturing organization one time, and he said, "Oh, you're involved in a health hustle." And I sat there and I thought about it. I was like, yeah, I guess you're right. We're kind of involved in like a well-being pyramid scheme. We're trying to get a couple people involved who tell a couple other people who tell a couple other people. And so that's kind of the business that we're in. So let's talk about the why that this is important. Going down a rabbit hole really quick is when we talk about research history, we think about a couple key things, key staples in research history that kind of brought us to where we go. One of them is the Tuskegee syphilis study. So there's about 100 people that were involved in this study that lasted over about 40 years that had syphilis, and these researchers did not tell them. They really wanted to find out what happened with syphilis whenever it went untreated. So they kind of lied to these individuals and said, oh yeah, you're going to get free healthcare if you come and participate. And then a couple people died. And this is one of the main things that led to the IRB reviews and getting consent and those types of things. Another one that happened in 1947 was really in Nazi Germany, not really a study, but the Nuremberg Code. You probably heard of these along the lines, but again, another staple in ethics, doing experiments on people without their consent, right, to get gain from it. Two other popular ones, Milgram's obedience experiments. So you probably saw some movies on this or some old history. They've done this on some other kind of parody type things. So this is the one where one person was on one side, the other person was on the other side, and they were like, oh, just give them a little shock. And the other people weren't getting shocked, but they were like, act like you were. And then they were trying to see if the people would continue shocking them, even though they said, no, it's not really hurting them. But these people were saying, I have a heart condition, I'm about to die. And they kept shocking them, even though they were saying those things. So, and then the Stanford Prison Experiment in 1971 conducted in a prison, really to look at, you have guards and you have prisoners. Well, what happens if those roles are reversed? Okay, so all these studies really kind of go into, we need to collaborate. We can't just do things to people, right? Again, in well-being, we can't just create initiatives because perception is truth. What do people think and I have experienced this on many occasions, whenever we bring in a new wellness initiative into an organization, the number one thing people think is the company is doing this to us. Right? They're trying to find out I have diabetes. They're trying to find out I have high cholesterol so they can raise my insurance or they can just fire me, which we know that that's legally not going to happen. But again, perception is truth. If someone perceives that to be true, that is their reality. And so that's where the concept of fast forward, community-based participatory research came about, where they said, you know what, let's try to start involving the community and what we are trying to accomplish. So a lot of times people will go out if they, Native American tribes actually have done this a lot. They'll go involve the chief, or, if they do research in churches, they'll involve these community stakeholders, people that have influence or people that have an investment, to say, we're trying to accomplish this. What do you think? What's going to hit home for your population? Because you know your people better than I do. And this is the same thing with our middle managers, with our champs. You're around your people every single day. Our team is in HR. We're a team of 8, but a team of 8 for 13,000 employees, we're not going to be able to get everywhere. We're not going to be able to understand every single dynamic of every single department, because it's all different. Every group, the dynamic of Midwest Business Group on Health team is different than any other team. At the speaker dinner last night, I had a great time. I think it's a fantastic team. They know how to have a good time, right? That's great, but that's not the same perception that everybody else has. So it's really about changing the power dynamics and increasing the equality. We talked about DE&I, to ensure that people don't feel like what you're doing is being done to them. It's being done with them. We are your partner. We are not here just to say, you need to do this. You need to eat right. You need to exercise. You need to lose weight. I have so many people that come by me and they think I'm just going to slap a chip bag out of their hand and chastise them. Or they just run by me and be like, oh, no, my doctor already tells me I'm fat. I don't need you to do it too. I'm like, I would never do that, for one. But that's just the feeling that people have about well-being, right? So let's talk about the application. So we have these spheres of influence. We have the socio-ecological model. And so we have our individual sphere. We have our behaviors. We have the reasons why we make our decisions. And then we have our interpersonal influence. Dr. Mark Campbell talked about togetherness. There's a lot of research that says the people you hang out with influence your decisions. If you hang out with people that exercise, you're probably more likely to exercise a little bit more. If you hang out with people that drink, or if you hang out with people that do drugs, that's kind of the research on smoking and quitting alcohol consumption. The best way to not be around that, or to quit that, is not be around it. Don't be influenced in that regard. We also have our organization. The organizations where we work has an influence on our well-being. And I don't think we're there yet. I think a lot of senior leaders and a lot of organizations still believe work is work, life is life. You can check it out the door. How many people really believe that? You cannot just check your life at the door and be like, no, yeah, I'm not having marital problems. I'm not about to lose my house. I don't have family that live, in parts of the country that are, devastated by weather. Your life is going to influence your day-to-day job. Okay, so your organization, how it's set up, how these tables are set up, influence our decisions, right? I'm not bagging on Midwest Business Group on Health, but if y'all had stand-up tables, or if y'all were forced to stand in the back, that setup's going to influence our decisions, right? Or if we didn't have water on the table, right? So we have to think about the environment that we are in. Is there fast food? There's no access to parks? There's no access to gyms, right? Safety, community, sidewalks. Is it safe to be well where people are? And this one's a little bit difficult in organizational well-being, because, we really think, well, what can we do? Someone told me one time, why ask the question if you can't do anything about it? Right? If you ask somebody, are you safe where you live? And someone says no, what are you going to do about that? Are you going to buy them a new house in a nice neighborhood? Probably not. But then you step back and you say, well, what can we do? We actually offer discounts to ADT. So you can offer security system discounts, right? That's something that you can do to influence the community to help them live better and have better well-being. And then last is policy. So we are kind of governed by ACGME because we have trainees, we have residents. You might be governed by your internal policies, but different policies influence well-being and our decisions, our behaviors on a daily basis. Do you have a policy that says you can go to the gym during the day? Do you have a policy that says, time off policies? We have volunteer time off. So you have 8 hours of volunteer time that you can just take during the year to go serve in a community. Okay, so there's policies that drive our decisions. All right, let's talk about asset mapping, which is really kind of what I go to UT Health and asset mapping and intervention mapping stakeholders is really kind of focused at U of H, really spreading throughout the area, but it's sitting back and looking at what settings can be harnessed in that priority population. So we won't do the activity yet, but kind of get those balls rolling to say, if we're going to, as an example, if we're going to promote a wellness initiative, so or whatever you want to do, any kind of initiative or resource, what assets do we have available that we can utilize to make that resource implementation more successful? Okay, so we'll talk about that whenever we go through the activity. What policies can we edit, alter, look at to ensure that that implementation of that resource is more successful? Information environment, what communication channels? Do you have newsletters? Do you have the intranet page? Do you have the external page? Do you have wellness champs? So all those ways that you have access to communicate to that target population. Again, I'm talking some research terms, but it's really research and well-being is pretty applicable, right? We have a priority population, a sample group, and we have an intervention, we have a variable that we're trying to implement and change the outcome. Just like research, just like any research study, right? So these same things apply. You have the built environment, we just talked about that. And then you have the social, organizational, culture environment that you can change to make that difference. And we'll go over an example in just a second. And then we'll talk about stakeholder mapping. So we'll talk about a Baylor example, but what is stakeholder mapping? Again, stakeholders are individuals that just have influence. Okay, and we talked about that social ecological model. Those influencers can come from any one of those circles. So in visual or physical representation of various individuals that have a say in the implementation. So whether they have a direct peer-to-peer knowledge, or they talk to these individuals, D&I, check with if you consider every single group. So one of the things, this isn't the example that we'll use, but one of the things that I did whenever I was in school is resident well-being. So trainees, residents work about 80 hours a week. And so one of the papers I wrote was about implementing a wellness, mental health strategy. And so whenever we talked about the stakeholder mapping, we talked about the chaplains, the lead residents, the champs, external psychologists. Like, you really have to dig deep and think, who can I talk to that could help me in this situation? Whether they're a decision maker, whether they're just a reviewer, whether they're just kind of an early adopter. So what role are they going to play? And you have to run down that gambit. So the example that I'll use that we actually did use this whole process was that in January 1, we implemented a new wellness portal. And if you have a wellness portal, you know what a big job that is. And the number one thing that is key for a wellness portal is what? People got to use it, right? If nobody uses a wellness portal, one, it's not going to make a difference. And two, you're just wasting money. So whenever you spend this kind of money on this software, you need people to use it. And again, people don't want to be told what to do. So we want to include as many people in the decision-making process as we could, and as many people in the rollout process as we could. So, and just to give you a little bit of history on that as well, for the past 10 years, from 2014, as Paula mentioned, when our program was implemented, to 2024, we used Vitality. The Vitality Group, Vitality LLC, International Wellbeing Platform. We actually just switched to Asset Health as of January 1. Not promoting them, but just to let you know, that's who Baylor uses. You can find that anywhere online. And so what do we have to look at? Well, we have to look at our policies. And so again, I mentioned ACGME. there's guidelines that we have to follow about what well-being resources we provide to residents, trainees, and faculty members. Okay, so that's a policy we are governed by. We have our internal policies. So we have compliance that we had to go through. We looped in IT security because Baylor actually has global employees. We have people that do research all over the world. So there's security measures that we have to think about whenever people are trying to log in from Botswana in Africa. Okay, so we had to loop them in on the decision. Legal, outcomes-based, reasonable alternatives. We have an outcomes-based program. Not to go down that other rabbit hole, but if you don't know the difference between participatory programs and outcomes-based programs, participatory programs are just you get an incentive if you go to the gym. Participate, incentive. Outcomes-based are you have to participate, but you also have to have an outcome. You know, is your BMI in healthy range? Do you go to the gym, but have you lost weight? Or do you go a certain number of days? So those are outcomes that you have to accomplish to get the incentive. If you have an outcomes-based program, you are governed by a lot of regulations and laws that you have to follow. One of them is reasonable alternatives. If you do, we do biometric screenings, but if you do a biometric screening and someone has a medical reason why they can't achieve your incentive, you have to give them alternative every year. Same thing with smoking. Okay, you have to give them alternative every single year. So those are things we had to think about in this system. What alternatives do they have in place or that we implement? Social, environmental, peers, middle managers. I always say that middle managers are really that concrete layer because if top down, our CEO, President, Dr. Klobman, he could say till he's blue in the face, we believe in well-being. We think that our employees should have access to these resources and participate in these resources. We have the bottom-up approach from us and our champs to say, yes, this is great for you. You should participate. And then people get a side eye from that middle manager whenever they're trying to participate. Do you think that they're actually going to participate? No. Right? Because their peers are saying, where are you going? Why are you going for a walk? Or do you still have people that think that they can't take a lunch? Like, again, perception is reality. They just sit at their desk and power through because they feel like they can't get away from their desk. So middle managers were key. Senior leadership, we also have Baylor College of Medicine is kind of a three-pronged business model. We are one of the top NIH grant-funded institutions in Texas. So we have a big research arm. We also have a big medical arm. So we have Baylor Medicine, and then we're also a school. So we have about, again, I mentioned we have about 1,800 students, 1,600 students. So those are a lot of moving parts. And so our goal for Baylor Medicine is to get a lot of people to see Baylor doctors, right? And we fight hard to keep kind of church and state. Right? We want to do what's right for people and they have a personal decision of who they see. They're like, yeah, but the best people are Baylor College of Medicine doctors. So in this system, we're able to kind of triage people once they take our health assessment to say, okay, you need assistance. There's assistance at Baylor Medicine. Where they choose to do it, it's totally up to them. Information environment, again, communications, we loop them in, champs, IT, trying to get the message out, the changes coming up toward the end of the year, and then built environment. Everybody needs an app. Our faculty members who are never on their desktop computer love the app. So we had to make sure that this system had an app. We had to make sure that people have access to computers. Our facilities people, we have people on the animal care team because we do a lot of research. They might not have access to computers all the time. Okay, or people that work in other countries, people that work in small clinics throughout the United States. So that's asset mapping that we'll talk about in just a second. So stakeholders, whenever we narrowed it down to three potential vendors, we actually had about 20 people attend those presentations. We had our chief medical officer, we had our executive assistant to our president and CEO, Dr. Klobman. We had people from benefits, we had champions, we had our wellness team, we had our chief HR officer. So everybody was in those sessions able to ask questions that might be relevant to their group. Because again, we don't know everything. And we are not shy to say we don't know everything. So we need those other people to ask the questions that we might not think to ask, especially IT. I'm not an IT person. I know just enough to be dangerous, right? I'll probably make your computer blow up or something like that. But we need those people to think and say, well, what about this? What about single sign-on? What about this? What about that? What about this layer of information that we didn't think about? And then after the 3 finalist presentations, I just did a poll. I said, okay, let me know your feedback. What do you think? And they actually came together and said, you know what? I think asset health is the best way to go. So now that they feel like came along in that decision, do you think that that's going to help them push that initiative a little bit better? Yeah, because they say, well, no, I've seen the demo. I know this. I think that that's going to be beneficial to our community. So if you need something from them later on, they're going to be more favorable to assist you in that regard. And then after, so just kind of further that a little bit more, after we decided on asset health and moved forward with asset health, we actually had a demo site and 20 is an arbitrary number. It wasn't exactly 20, it was give or take. But we gave everybody a demo account in that system. So now they can see what they chose and they can go in and say, no, this wording doesn't make a lot of sense. Asset Health is a very customizable system. They can say, let's do this pictures. It's not very inclusive. We need to change this. We need to change that. And so I just funneled all the feedback and sent it over to Asset Health. Again, because now they feel like they have, and they were involved in that decision-making process. And I guarantee you that just making people feel involved, doing it together, has been a world of difference. Again, people don't feel like it's being done to them and they're being told, no, we're doing this. It was only our decision. We made this decision and you have to go by it. They feel included in that decision. Okay, so what I want you to do is we have about 15 minutes left. And so I want you to take that worksheet, think about an activity, and I think everybody should. I think there's 5 or 6. But think about a change or an intervention or resource that you are trying to implement right now, or you're thinking about implementing. There's a lot of vendors here if you need a resource to implement. So again, just take probably 30 seconds. Again, the goal of this is not to get 100%, right? Define all these different things. We did that implementation process over 1.5 years, right? But I think that this will help you provide you with something that you could take back with you today after this conference and really dive in a little bit more, meeting with your teams and including people. So take about 10 seconds, 15 seconds. Just think about some kind of change. Think about the priority population. Maybe it's your workforce. Maybe it's your middle managers. Maybe it's your internal team. Maybe you're trying to implement some kind of strategy, a change in your internal team only. And I will ask a couple people to share afterward. So muster your confidence while you can. All right, so and I'm going to go back just so we have an example again. So let's go down to the next thing below. If you have your resource, your change, your intervention that you're trying to implement into your organization, you have a priority population in mind for that. Think about the different assets that you have to think about to implement this strategy. Okay, so do you have internal, like if you're trying to implement a mother's aid station, a lactation room, like what kind of policies do you have around that? Do you have building policies? If you are a nonprofit, do you have policies around that? Incentives, another example, we had to think about the policies around incentives, how we give gift cards and well-being campaigns. Any gift card is seen as taxable income. So we had to think about that. So list a couple policies that you might have to consider when thinking about this intervention. And again, discuss. Again, we can't do this in silos. We got to do this together. So talk amongst your table, make some friends, introduce yourself. And once you think about a couple of policies, You can move on to the social, organizational, cultural environment. You know, do you have to think about department dynamics, middle manager, employee dynamics? Like what dynamics do you have to think about involved in this implementation? And your voices, I like it. All right, and then the next one, information. Think about the communication channels that you have access to. This is probably a long list, and you probably don't. We have really 30 different ways that we communicate our resources. So we have newsletters, we have the platform, we have weekly emails that go out to employees, we have screens that we can post messages on, Facebook pages, like all those different ways that you can get information, app notifications, direct presentations. We actually talk in our open enrollment benefit presentations. Then we use our champs. We put things in the bottom of our signature. Like no wrong answers. This is a brainstorming session. Literally brainstorm every single thing that you have access to. And then the last one, list some things for the natural built environment that you might be able to change to help push your initiative forward with the implementation process. So if you want to, some things people have done, if you want people to walk more, maybe turn off laptops every hour, shut them down so people can't use them. People have done that. If you need to rearrange structural redesign, rearranging the room. And then on the back of your worksheet, you're going to see a table to help set up your stakeholder mapping. So think about who the stakeholder is, what their role is, and then you can define a little description. So if it's your boss, maybe they're the decision maker, and you're going to put in the description, they're going to make the decision on whether we're able to implement this resource or not. If it's a champ, then they're going to be a communication avenue. The champs are going to help adopt this resource, and they're going to help talk to people about it. So think about who those stakeholders are, what their role might be in implementation of that resource or intervention, and then just a small description at this point of what they might do. Okay, yeah, that's perfect. Yeah, perfect. You said that's not included in there? That's not included in there, or it is? Okay. All right, I'm gonna give everybody another 60 seconds to help fill that out, and then we're gonna ask for some brave volunteers to just give a general overview to maybe help others. All right, I know we have some mics that we can walk around. Do we have a brave soul that wants to talk about just quickly, their intervention, some assets that they thought about, and then some stakeholders that they might consider involving? Anybody? We'll call on people. Paul, I'll let you pick someone. You have the mic. You get to pick someone.
I don't want to do it to them. I want them to feel like they're a part of it.
This table has a lot of conversation going on over here.
Yeah. Hey, we have a volunteer.
You were the main talker, so I was like, yeah, something to
We
say.
have 2 volunteers.
All right, we got a volunteer.
Hi, everybody. My name is Peter. Last year we implemented with Virgin Pulse, now Personify Health, for our wellness vendor. And I got the opportunity to kind of have a HR versus finance challenge. And we, for the first time, encompass also our international employees. So, for 2025, we're really looking at something that we looked at in 2019, and then COVID happened, and then we had a lot of other issues come up. And so for us, it was, how can we get a pulse of what are our international benefits that we're offering, and where are they getting those benefits from? What can we do to help support those challenges that they might have benefits wise? And just kind of be more encompassing as a benefits team, not just solely focused on the US benefits, but globally. So, and then when you think about like the, policy environment, you can think of when it goes to like the asset mapping, the legal side of things. Our legal team is talking to us all the time already about, GDPR and ROPA, and I'm throwing all these buzzwords out there. I'm sure everybody knows. But those are just some of the things that kind of slow us down. And so I think that, you were talking about those stakeholders, and I really think for us, just the beginning portion of us to kind of get into those spaces that we're not comfortable with is to get, for example, the legal team, I think IT as well, to get that comfort level more for us. And then we can kind of have more of that buy-in to have those conversations.
Yeah, that's fantastic. That's a great example. And again, going back to the theme of the conference, right? Turning the wellness paradigm upside down. One, we got to change the perceptions, right? We have to change the perception that people feel this is being done to us, this is being done with us and alongside us. Two, I think we're still in our organizations today, we're playing in our own sandbox. We're like, this is my initiative. Don't get involved in it, right? And as again, Dr. Campbell mentioned, we have to do this together. We cannot solve the issues that we're going through alone in silos. We have to break down the silos. And that's a great example, again, because we have people that work overseas, but we also have people that work. So I mentioned Baylor Medicine's business model. Our main business model is that we work with affiliates. So most of our faculty actually work in other hospital systems, Texas Children's, Methodist, Benton, and they work outside of Houston. So if anybody has remote employees, that they usually don't feel involved in the decision-making process, because you really have to think, well, we have to make the decision best for the majority of the population. What the majority of the population is this group. But then you have to think about, well, there's different things that they're dealing with, and we want to make sure to include everybody. Yeah, so great example. Thank you so much for sharing, for being brave.
All right, I think.
Anybody else? One more?
Yeah, I can go ahead
Nice.
and go next. My name is Leah Holsworth and I'm with AbbVie. So we are about 55,000 employees in 67 countries. And I manage our global wellbeing program. So we kind of are in a little bit of a different space in terms of we used to do outcomes-based wellness, which was great, but we turned away from all of that. And we are just very, very much focused on how does well-being impact our culture at AbbVie? How do we amplify our culture? How do we really tie into our business senses, the business needs, the business requirements, and how are we really, again, amplifying what does that look like? So as we were going through, what does this look like? We recognized that we needed to get with our people leaders, and I'm talking a little bit later, so I promise not to tell too much. But when we think about some stakeholder management, we knew we were going down this path. And we knew we were going to need to partner across all of the organization to be able to do that, because culture is a big thing. And we didn't want to take over culture. That's not us. We are definitely, how do we continue to really push and to amplify our culture? So as we went through that, we needed to pull together who is going to help us with this project. And we just made sure that we needed a global lens as well. So we pulled in, from our culture team, our learning and development team, our employee health and safety team, our EED&I team, a long list of research and development, people from commercial operations, R&D, our aesthetics line, all came, and we pulled them all together. We kind of came up with, this is what we want to do. And then we had a half-day seminar, which always starts really, really in the morning, because you never know where people are going to come from, because they were from all over. Whether it was in Europe, it was in JPAC region, LATAM, everywhere. Had a half day to figure out what does this look like. We knew we were going to step on toes. We wanted to make sure we were only stepping on toes that they agreed to have stepped on. And we came up with what we wanted to do. And then we ran it through, I have a 10-member global advisory board, because they're the ones that make sure that I don't do something really stupid culturally, and wanted to make sure that, hey, this is what we're doing. This is what our initiative looks like. Fine-tuned it, gave us feedback. We took feedback again. We sent it out to our champions for their thoughts. And then we kind of cascaded it up to the CHRO. What is that going to look like? Had more feedback and brought it back down again. And so really what we're doing and what came out of it is stuff that we'll talk about a little bit later, but it's how are we engaging our people leaders? Because we know if we're going to positively impact the organization, our people leaders need to understand the importance of well-being.
Yeah, that's fantastic. Thank you so much. We're running out of time, but I want to make sure that one of the best reasons why I like coming to conferences like this is to learn from all of you. Again, I am not afraid to say I don't know everything. And we can learn so much from each other. I learned so many nuggets from people that are just implementing really cool things, really cool initiatives. They're trying to do it a different way. So I encourage you, and I think we're about to take a break pretty soon, or during lunch or something like that. Mingle, network, talk to each other about your ideas, and can help you grow. I'm going to leave you before we get to questions. We have about 40 seconds before we have time for questions. A bad example of why and why this is so important. So we actually just recently also took over recognition appreciation, and we enhanced our years of service programming. We've never done a 1-year award, and so we wanted to recognize people that have been to the company in 1 year, right? Research shows that most people are with organizations less than 3 to 5 years, right? There's typically a lot of turnover. So we want to recognize people that are there for a year because we think it's a huge milestone. So we designed these pins that we thought were really cool. It was a surgical mask. And a lot of times whenever people, doctors will take their mask down, that string looks like a heart, right? So where the nose is, it looks kind of like a heart. And so we were like, man, this is really cool. We created this really cool pin, made about $100,000 worth of pins. And we got them. I have 3 boxes in my office. We got them, get a message from our CEO, our executive assistant, says, Dr. Klobin hates the pin. He says it looks like a shark tooth. And I was like, what? No, it's a heart with a surgical mask. It completely missed the mark because we included a couple people, but we didn't include the right people, right? The people that would push this initiative, give it out to the entire college. So now I have 3 to 4 boxes of shark tooths sitting in my office that I don't know what we can't send them back because they're our pins. So we're going to have to figure out something to do with them. But so that's why it's so important. Again, you'll save time, you'll save money if you include the right people and just try to plan ahead of time. So does anybody have questions or chat? If anybody on the chat.
Well, I have
virtual land.
Yeah. Do we have some? Did you say that there's a question back there?
No, I was pointing at the camera.
Okay. So where are our pins?
I should have asked you about it.
Yeah, you
told the group.
That's a story, though. Thank you for being so transparent with that. I've got a quick question. I'm seeing the stakeholder mapping lists there. Were any of those stakeholders resistant in engaging in the project? And if so, what did you do?
That's a great question. Some of them weren't included in the entire process based on their schedules. Like I said, our chief medical officer, very busy. He attended one of the 3 demo presentations, and then he had some people stand in. I think one of the things that we did to help with that is that we recognized their busy schedule, and we said, if you can't attend, send someone in your place, like a representative for you, which I think they appreciated that. I didn't find that anybody was just like, no, I don't want to participate. I actually found that they actually nominated others that weren't even on my list because people want a voice. And they're like, well, what about this person? They should have a voice. We have a Baylor team shop. And so something that we were able to implement in this new portal is that part of the rewards, people can get Baylor merchandise. So everybody was like, well, what about Baylor team shop? They should be in this as well. So we actually didn't have people that didn't want to participate. We had people that wanted to nominate others, and it kind of grew more than what I wanted it to. I didn't want it to be like 50 people trying to, because everybody knows if you have too many decision makers, you're never going to get anything done. So yeah, absolutely.
Very helpful.
So be flexible.
Any questions in the audience? Because I have another question. How did you roll out your wellness portal and how are you keeping it fresh?
So we rolled it out again January 1. So this first month we work with, actually December, we work with communications to roll out an FAQ. Another thing that nobody likes is change. And so we use this one platform for 10 years and then all of a sudden it's completely different and people didn't understand it. So we actually work with communications to send out an FAQ to say, these are the changes. This is how it impacts you. This is what you need to know now because everybody had to spend their incentives out of the old system. This month has been hot and heavy in promo tables. People have been asking us to do department presentations. In our program, I was kind of brought up in the trenches, guerrilla warfare mentality of well-being. I'm like the post office. If it's raining or if you want me to come out at 10 p.m. on a Saturday night to talk about well-being, I will, right? Because that's where they need to know the information. And so I think people have been appreciative of that, is that we've had 6 different demo presentations. We recorded them. We record all of our presentations because we have a very dynamic workforce that can't attend during lunch or they're not at their computers, they're doctors, they're clinicians, staff, nurses. And so I think that that's been very helpful for people, is that they know that we'll do whatever we can to help them understand how to use this new system to benefit them whatever the way they know how.
Have you implemented any kind of measuring ways to measure the success of the program?
Right now, we're just using participation. We want to get up to 40%, which is, we had 40%. We had about 70+% that were signed up in the system. But that number, again, full transparency, is a little bit skewed because whenever we implemented the Vitality system before I was hired on there, they said, if you sign up for this system, you'll get a $50 gift card. Well, guess what happened? People signed up for the system, got their $50 gift card, and never logged back in. And so we had 70% that were enrolled, but about 40% were actively participating. So we really want to get up to that number. So that's goal number 1. And then we'll add in the ROI. We have a relationship with UHC, CVS Caremark, and our platform to get those claims analysis and measurables and stuff like that. So we really base our program outcomes on those markers, behavior change and outcomes.
Excellent. Let's thank Jesse. That was outstanding.
Got it. So hold your hand.
Oh, you could. Everybody gets a hug.
Everybody gets a hug today.
I love it. I'm a hugger too, Mark. Whether people want it or not. Okay. So I know that we have a break coming up, but before we do that, I would like to introduce a word from one of our sponsors, Color Health. And I want to share with you that this video is intentionally silent. And as Dr. Campbell suggested earlier, let's use this time to be fully present. Okay. I have never seen employers more engaged in cancer benefits. We're working on a few projects right now related to this, and we're happy to share what we're doing. We already have we call it the Oncology Learning Collaborative, and I'm doing it with my sister coalition in Florida. We have a very, very comprehensive oncology benefits guide. The 7 steps from prevention all the way through treatment and end of life and return to work. So if any of you are interested, go to the community link on our homepage. And would love to get your feedback. With that said, we have our first big break of the day. Please visit our sponsors and make sure to turn in your prize drawing card by 2:25, and we'll see you in a few minutes.
All right, good morning, everyone. This next session is the only thing standing between us and lunch. So we're going to get started so we don't run into lunchtime. My name is Dawn Weddle. I am the Vice President of the Midwest Business Group on Health. And I am so honored to be introducing our 3 employers for our next employer panel, but just a couple of housekeeping things before we get started with that. Number one, I just want to thank you for spending time with the sponsors. I walked out into the exhibit room and just here in this room and just love seeing all the interaction that was happening. And truly, we could not do these kind of events without our sponsors. So thank you for taking the time to learn more about what they have to offer. Yay! So in keeping with our theme, I'm just going to start by sharing with you briefly what gives me my power. And as I was listening to Dr. Campbell this morning, I feel like I've drank the Kool-Aid. I really do feel energized and powered up by being outside. But then he shared that stat that 90 to 94% of our time is spent indoors. And I got to thinking about any given day in my life. And I'm right there with the average American. I'm pretty sure I don't spend much more than 6 to 10% of my time outdoors. So I'm going to take some of those hints that he gave us to heart. But as you can see in this picture, that's me in my happy place. This is at the top of Quandary Peak in Colorado. It's a 14er. And what you don't see in this picture and what's behind the camera are my 2 adult daughters, my sister-in-law, and 2 close girlfriends. And we did this pretty arduous long day hike. And as I think back to that day, and that long weekend that we had together, my ratio was flip-flopped. I was outside 90 to 94% of the time. And I know I can't do that given my day job and, other things that are going on. But I sure am inspired to get closer to that percentage than what I'm currently living. So before we get on with our panel, I want to take time to share a little bit about one of our sponsors, Novo Nordisk.
Some things can be solved alone, but some can't. Some obstacles can be solved alone. Others can't. Some tasks can be solved alone, while some can't. Some challenges can be solved alone. Obesity cannot. It will take collaboration to take on this challenge and change the future of obesity.
Obesity is certainly a hot topic when it comes to employer wellness and health initiatives. If you haven't spoken to our folks at Novo Nordisk, I hope you'll do so. They're right around the corner. So before I introduce our speakers, just want to do another quick polling question. So if you could take out your phones, and we want to learn a little bit more about what is the main driver of your current health and well-being program. So if you go to the polling app or box, is it all about employee attraction? Is it about health and well-being, morale, retention, lowering your medical claims, ROI, staying competitive with other organizations? Pretty unanimous. I mean, you guys are looking out for the health and well-being of your employees, followed by lowering your medical claims and morale and staying competitive with other organizations. Got a couple of votes as well. So thanks for sharing that. All right, now on to our Power Moves panel. So we have 3 employers with us today. They're going to be sharing with us how not only are they putting into place effective wellness programs, but they're also going to be talking about how they've leveraged some of their vendor partners to do some pretty grand things, to lower healthcare costs, to provide equitable access across diverse populations, to find the right communications, to engage their employees. So we're going to hear some real life examples of how those relationships can be beneficial, not only to your employees, but to the organization at large. Our first presenter is Cameron Demmel. All right. He is the Vice President of Strategic and Federal Relations at his law firm, Brown & Brown. In his role, he leads the federal health plan business and also manages their strategic relationships and vendor partnerships. When we asked Cameron what gives him his power, he said it's his family. But then he went to go find a picture to send to us of his family, and he could only find this picture of them at the holidays. So he also realizes maybe he should take more fun photos with his family. But with that, I will turn it over to Cameron.
I didn't realize we're going to open a vein about my family and pictures and the lack thereof. And actually, in all reality, I was joking with Don and Paula that in looking for a picture, I'm like, God, the only one we have is this one and another one, more recent, I should say, of after my daughter's band concert. So anyway, with that, I will say this. So I currently work at Brown & Brown, but for purposes of this presentation, I'm taking a step back to my previous job at the National Rural Letter Carriers Association, the Rural Carrier Benefit Plan, and I was the director of that plan for 10 years, and then moved over to Brown & Brown in 2023. So recent, they're also a client of ours, so I stay close with the current director and know where things are going there. So for today, I am very much Rural Carrier Benefit Plan guy director. For those of you who know the Federal Employee Health Benefit Program, it's wonderful. It's fantastic. Obviously near and dear to my heart. But the Rural Carrier Benefit Plan was one plan of many inside the Federal Employee Health Benefit Program. The program is overseen by OPM, Office of Personnel Management. I'll try to leave my acronyms to that. If you really want to go deep, I'm happy to do that later at some point. But the rural carriers, it's the rural carriers of the Postal Service. It's the folks that you'll see out on rural roads, driving on the wrong side of the road, putting mail in mailboxes. Surprisingly, it's a lot of suburban area as well. But in thinking about that plan at large, obviously a national footprint, they serve every zip code in America, as well as many of our territories. Average age is 57. So right there, there's probably a pretty significant disease prevalence, a lot of knees, a lot of hips being replaced, things like that. And so a lot of costs in addition to just general rising healthcare costs. In addition to that, had a lot of entrenched interests. The administrator, Aetna is the current administrator, CVS is the current PBM. The administrator position, it's been the same company for 65 years since its program inception. Obviously, there's some iterations. It was Mutual of Omaha, then Coventry, first off Coventry again, and then Aetna bought Coventry. But the relevancy to this is that there was no motivation for them to improve. And we saw that early on. I started there in 2013, and right away it became apparent that this is, a happy kind of fat carrier that just going through the motions and collecting money. And it really turned us off quite quickly. Additionally, I would describe them as that their disease management, their health and wellness program were very much off the shelf, rudimentary. The website would make, 1999 blush. It was terrible. And so we just had a lot of problems. In addition to that, we just kept seeing the same medium and high risk members, about 7,500, about 8,000 members year over year over year. And we kind of finally said, all right, that's enough. But before I get to that, just speaking to health and wellness participation, tobacco cessation, a lot of health and wellness programs. If you have 1% participation, that's pretty good. I would argue if you have high single percentage, that's really good. And if you're into the teens, you're one of the best. but we had such low participation, and we're talking like 0.005% participation. The last year we had, kind of before the solution partner inevitably unveil, before we had them, had, I think, like on average would enroll and have 40 participants a year. So on a population of 60,000, maybe A, that's really good because we have no smokers, but that's not the case. But B, it's just they weren't doing the job. So with all of that in mind, we had to kind of take a step back and reframe and kind of recharacterize the problem. Recognize there's no innovation, there's no growth. One of the challenges we had is there's no data. It's inside of Aetna, and they don't like sharing it, even though it's our data. And so we started asking questions. Is data shared? Why are we only focusing on these medium and high risk? Why, at that time, are we only focusing on 5 disease management programs? That's it. It was very silent. Diabetes, a couple cardiovascular, and 2 others. And so we started asking these probing questions. And as you can imagine, if you've been in this position before, when you start doing that to an entrenched carrier, what do? I don't like it. They're not going to sit by the side and let you roll over them. And so it became very, very, very challenging. So that's where we really had to kind of reframe the conversation, recharacterize it. And as we went along, some of the things we did in additional questioning is, it got pretty heady. I think a really turning point for us was when we stopped thinking about obesity as a lifestyle, but as a chronic condition. Because you think, if considering all the other chronic conditions, if you can turn obesity around, what happens? Improvement in diabetes and improvement in anything cardiovascular related and a number of others. So that really changed kind of the dynamic that we looked at. So you can see up there on the slides with regard to, what we did. The other piece of it is that we started to really look at and try to leverage the best relationship our members have. And who's that with? I'll tell you right now, it's not with the health plan or the insurance company. It's with their doctor. And how could we leverage that? How could we be a complement to that? In reality, it was very hard to do much of anything, but we looked at to say, okay, how are we not an impediment? Is there things that we're trying to do that puts us in between a doctor and a patient, and stop doing that? Last but not least on the side, I think I can't emphasize this enough, but just, to be able to work with your population, your members, your employees, to me, you really have to have benefit continuity. And what I mean by that is year over year, you're not making big changes. Obviously in our plan, it's, kind of a typical, we'll say union benefits. So, modest premium, robust benefits, and, pretty low copays and things like that. And so we were laser focused on, all right, let's not change the copays on drugs, even though we might be, having to take on a bit more cost. But how do we eliminate, these small impediments? At the end of the day is, if we can't do the basics well as a plan, how are we ever going to earn our members' trust to, hey, engage them with health and wellness, to get them to participate in disease management? And if we're really, really lucky, how do we get them to turn back the clock on disease state? How do we get them from medium to low risk to pre, and even better than that? And so that really had kind of a foundational kind of tectonic change for us as a plan as we went forward. So I'll leave, you can take a look at this, and it's all very real, but I'll just kind of describe kind of how we got there, because this was over a course of 3 to 5 years. So number one, focusing on tobacco cessation, the previous vendor, getting 40 or less participants a year, we turned that over to our solution partner. Ironically, the solution partner was brought to us by our administrator. They didn't know that we love them so much that we do a whole lot more, much to their chagrin. Almost overnight, we saw a surge in use in tobacco cessation. So we love that. Next, we said, well, you're doing so well there. You can also help us with HRA completion and biometric screening. Prior to them, HRA was a clunky 80-question paper document. Our advice to our members was go print this, or we'll mail you a copy, fill it out, take it to your doctor, and then send it back to us. Well, who in the hell is going to do that? Pardon my language. I promise I won't go any more than that. I'll hold back. I'll wait till after lunch somebody can do that. But anyway, the point being is It's horrible. It's clunky. And so we turned it over to our solution partner. And again, overnight, it was just explosive growth. I mean, we're talking in the first year, and now this did level off, but under 100 completions. When we turned it over to our solution partner, they were well over 1,500 completions. So some terrific work. That evolved into kind of a comprehensive pain management program. And that is at the time, so it's kind of 16, 17, 18, when the industry's answer was kind of say no to opioid prescriptions. We relooked at it and said, well, wait a second. What about people who have a legitimate need for a pain medication? What about people who, are worried about it coming out of surgery? What are they going to do? So we launched with our solution partner a comprehensive pain management program, and really it was full steam ahead from there and opening up, to work on obesity, GLP-1s, weight loss, all that fun stuff. So as you see, it's comprehensive, it's really focused and individualized. At the same time, incredibly adaptable and incredibly flexible, meant to meet the member where they are, meant to adjust to, where they are and what life throws at them. Most people aren't taking their meds because they don't want to take their meds. It's because there's other complications. Or if they're not adhering to a treatment plan, they're doing so because, well, hey, they're taking care of grandparents. They got 3 kids. I have 2 kids, 9 and 13, and sometimes I walk in and want to walk right back out the door. So there's always other dynamics at play, and that's where our partner could help us. We had dedicated health coaches, and what I loved about this is we had a lot of member meetings. So we'd have our coaches come to our member meetings. And it was so wonderful to see that interaction between the coach and, people they may be working with. And of course, when they did find one they're working with, the hugs that would ensue and all the happy tears that would come of that. So it is absolutely member focused and really quite cool. And using the word cool with healthcare, health insurance is pretty cool itself. All right. So I know I'm going through a lot. By all means, come and see me later if you have any questions. But out of the gate, and it held over time, there's 4 times improvement in engagement with corresponding decrease in overall spend. We ratcheted up, we continue to do more, and the current plan director continues to do more with this solution partner. We made a better experience for our member, which is number one. While partner was doing amazing things, we improved all the communications with our members. We brought data in-house, so we captured that, we had that, and we could do good things with that. As I said, it was adaptable, flexible to the needs. We had performance guarantees tied to ROI. They were not meant to be punitive, but they were meant to be challenging. And we developed these alongside of year over year, our solution partner. And it says 5-year continued partnership. I was actually looking back. It's probably more realistic to say it's a 9-year partnership. So lessons for employees, and I'll wrap in 10 seconds here. Number one, for me, you need leadership support. In this case, where you're going up against the entrenched incumbent, they're not going to sit down and just say, okay, yeah, we'll give you whatever you need. So you got to have all hands on deck. Second, find partners, not vendors. There's everybody needs vendors. But if you really want to do some great things, you got to have a partner that you're going to trust, that is going to have your back. Because inevitably, something, and I won't use the word, but something will hit the fan. And can you trust, that partner company across the table? Be willing to change course, be bold. And last, it's not on there, I'd say, is be visible. I think being out in front of your employees, your members is crucial to hitting your goals. So with that, do I get to do the solution partner? Sure. Do I do unveil them? Okay, here they are. Trestle Tree is our solution partner, and they're back there if you want to go talk to them. They at least have squishy balls you can take home and give to your kids and start a little fight. Thank you.
All right. Thank you so much, Cameron. Boy, tall man. I had to stand on my tippy toes there. And we are going to be taking questions, but we're going to wait for all of our presenters to give you an overview, and then we'll have you shoot your questions to them. So our next presenter is the middle picture. So Adu Nasi is the head of U.S. and North America Total Rewards at Teva Pharmaceuticals. He's been at Teva for the past 7 years. Prior to that, he gained experience through his work at Mercer, BlackBerry, and General Mills. Like Cameron, Adu mentioned that his family is what gives him his power. And this is a lovely picture of his wife, 3 kids, and they're on a beach in Brazil, I believe. So do tell. Come on up, Adu.
Thank you, Doan. Hi, everyone. So yes, we are originally from Brazil, my wife and I. Our oldest son is also born there, but the other 2 kids born here in the US. So we like to travel. That gives us power. We try to go to different places, but going back to Brazil is always good to visit family and see some friends. So we went there last year. It's during the summer here, but so it's the winter there. So it's not always as warm as it could be, but it's always good to go back home. So as Don was saying, I'm responsible for total rewards for the US for Teva. We are a pharmaceutical company. I think, no different from anybody else in this room. I think the top 2 concerns, or maybe the top 3, one is, of course, the rising costs, right? I mean, as we see year over year, the medical inflation, the cost is really, something that everybody has to take a look at that. Top claims, a lot of, MSK, cancer, mental health, also being one of our top priorities right now. There is also a rise in chronic conditions. And even with all of that, I mean, we are kind of proud to say that, especially in the pharma industry, our benefits usually, they are richer than other industries. So even compared to our peers in the industry, we are more efficient than our competitors. So look at some numbers, we are around 10% below what would be the cost. For another pharmaceutical company with the same type of benefits and etc. But we always have the target about the national or the general industry trends. So that was one part that, that we need to tackle. So even in being very positive, we still have the pressure to lower costs anyhow, right? So that was one of the challenges. And the second piece was really the employee engagement. We have the navigation, the advocacy with one partner, which is great. I think that helps a lot as well, not only in the journey, but also with the costs. But still, there is a big part of the population that we ended up not engaging with them, right? Which are the people that they don't do anything, they don't do the regular visits to the doctors. So this was one of the big, gap cares that we have, and everybody has, right? I mean, as a public, as a country, or as a company. So we were looking for a partner to try to tackle both of those, issues. So we started talking to this vendor a long time ago, and then in November of 2021, we decided to go with a pilot, with our sites in Florida and South Florida. It went really well. We ended up, around 18 months, 24 months with the pilot. We saw some very good results, and even when you look at the data, starting there in 21, 22, you can see that the trend is actually going lower. And then in October 2023, we decided to expand that to our entire population, which is around 5,200 employees, around 13,000 lives overall. So, we decided to expand it, and you can see even the results are in 2024 is really bending the curve of the cost. So we really believe in what we are doing. We really believe in this vendor. I'm really proud to say that we are customer number 1. So it was a very, disruptive thing to do. Sometimes at Teva, we are not that pioneer, but with this one, we decided to take the I wouldn't say the risk, but take the risk somehow. And we decided to go and to implement. So the solution is really about the prevention, right? I mean, how we can reach out to those members for them to go to the doctor every year to do whatever they have to do that is supposed in terms of their gender, their age, their family history. So this is one great piece about this vendor is that everything is really tailored for the individual based on their characteristics. And that is really on top of whatever we are offering, right? So the idea is really to focus on the transforming the cost of our top claims drivers, easy access to screening. In the next slides, we're going to show how employees or how the members, they can do that is very, very easy. So that helps a lot with the easy access. We have a very diverse type of population. We have manufacturing, we have labs, we have sales force. So it's really hard for people to stop, working and to go to the doctors. So having this as a very easy process helps a lot. The idea also about connecting every single employee to a provider. This is part of the process also. And easy navigation to our programs, right? So when they do a screening and something comes up as a risk, they can quickly connect to some of our other vendors, right? So we have already what I would say a robust ecosystem, but that was really the missing part that we didn't have before, right? Now I would say that we are kind of with a very strong and complete ecosystem. So I guess you guys saw this before, right? In the presentation, I'm still not saying the name of the vendor, but our partner. This is really what they are doing and helping us with that. So it's really autonomous prevention. It's doing all the personalized, as I mentioned before, right? So with the phone, you can do all these different screenings: cardio, skin cancer, lung cancer, colon cancer. Some things that even to say this out loud is kind of crazy, I would say, right? I mean, about the technology, but it's really, I think it's really disruptive. I think, it's a breakthrough technology that they are using with a lot of AI, but it's really with proven facts and data and a lot of data backing up, as Dr. Campbell was saying before. I mean, this is hardcore, scientific proof thing. So it's not just saying this out loud, but it is really very nice to see, again, with the use of the phone, you can do all these screenings and to start the journey, right? And I think the idea, especially for a lot of the things that we do or that we had before, it is more about the sick care, not about the health care. And I think what this vendor does, it's really about the health care, right? So the prevention. Let's try to get this early, an early detection. We were talking about this yesterday, right? I mean, cancer stage 4 is completely different than, early detection cancer. So the treatment is easier, it's cheaper, and it's not only about, the care, but also about the costs, right, later on. So if you can tackle this at an early stage, it is better for the member, it's better for their family, it's less absenteeism. And so there's a lot of things involved, in doing this this way. And what I said before as well, it connects to our, in-network providers. The idea is to have all these people connect to a PCP or a specialist. So again, we are really proud to be partnered with them. So some results in terms of engagement. Again, we started the big expansion back in October 2023. So around 18 months or a little bit less, we have already 32% of active employees, and they are really doing that, right? So it's not, and I know, that sometimes people just download the app for downloading the app, right? As their example, and but then they don't do anything. But in our case, people are really doing some of those or most of those screenings. So you can see about the engagement. It is different per location or per site. So it's also about, the team, the local HR team, how much they want to invest their time into it. So you can see some locations we are even above 50% of the employees engaging with the app. In some other locations, we have more challenge. So we have been working a lot in communications and doing some campaigns specific for some populations or locations. Some nice things to see, right? So in terms of the health impact, 72% of the screenings booked are due to the partner. So again, out of the 100% people who are doing, 72%, they engage with a doctor after that. And it's nice to see because I apologize. So 72%, they don't have a provider, right? So which means that they didn't have a PCP before. So they were not doing anything before having access to the app. And 47% of them, they also connect with some of the Teva programs that we have in terms of our benefits program. So again, it's really trying to engage everybody in this health journey. As you can see, all the screenings done, it's a pretty high number of screenings. So there's a lot of people. Some people really went full. I mean, they just go and they do all the screenings that we have available. Some more, they go to whatever they want to try. And there is also, again, the savings component, right? So they have their modeling for proving the ROI concept. We are still too early in the process, but you still can see, as in the first slide, right? I mean, bending the curve. So we are really going to the right direction. And we do believe that, this ROI is going to be even bigger in the near future as we continue to engage with all the employees and their family members. Right now, it is only for adults. So hopefully in the near future, we will be able to also involve the kids. And it's very nice to see the screening distribution as well, right? So with all the offers that they have, people are really engaging in all different screenings that they have to offer. So our partner, our vendor is Lives. They are right there. You can even try their technology, and it's really great. Again, I really believe in what they are doing. That's why I'm here speaking on their behalf. And again, this is really great for our Teva employees and their family members.
Awesome. Thank you.
Thank you.
Thanks so much, Adu. All right. And our final presenter is Jackson Sarver. Jackson is the Senior Benefits Specialist at NetJets. And our MBGH team met Jackson for the first time at our annual conference last year. If you were at our annual conference last year, you might remember that Jackson started his professional working life as a professional ballet dancer. And he gave that career up, but realized he still wanted to help people and be with people. And so that led him to the health and benefits field. We have lots of interesting folks that make it into the health and benefits field, but this might be a first for me, Jackson. So let's see. He is now overseeing the health benefits and serving as the healthcare advocate for the world's largest private aviation company. Jackson shared that he gets his power from also being with his family, but specifically inline skating. So it's a sport that he and his older son, I believe, started, and then the rest of the gang, his wife and his other son, wanted to join, and now they're doing some family inline skating together. Great way to be outdoors. I think that'll be Mark Campbell approved. So come on up.
Yeah. Can we start at 12?
Oh, gee.
That's all right. So before I get started, thank you for that introduction, Don. Before I get started, I actually need everybody's help by raising your hand. Everybody in the room, you in the back too, I see you. And even if you're online, I can't see you, but I know if you're doing it. Now, only lower your hand. Lower your hand if you do not have body pain. So neck pain, shoulder pain, back pain, low back, hip, knee, chronic, acute, long-term, short-term. You're getting ready for surgery and you have pain. You already had surgery and you still have pain. Yeah. And now you have shoulder pain. Okay, go ahead and lower your hands. So first of all, thank you for participating. I appreciate that. And we'll kind of touch on that here in a second. Now an introduction for myself. So just like Don said, my name's Jackson Sarver. I'm on the benefits team at NetJets. Who's NetJets? We are the worldwide leader in private aviation. We are best known for our unwavering commitment to safety, then service. We're a Berkshire Hathaway company. We're under the Berkshire Hathaway portfolio with Warren Buffett. We're a very diverse population. We've got about 7,600 employees in the US. We've got about 18,600 or so belly buttons. We have 5 distinct generations of employees. So from entrants just out of college, right? I think it's Gen Z now, all the way through baby boomers. So the needs of that population are very diverse. We also have a mix of union and non-union. And then we have diversity in geography. We have folks all across the country as well. So one of the challenges that we face is providing equitable benefits to all of those folks. And how do we achieve that? Another thing is, just like all of us here in the room, as an organization, it is incumbent upon us to reduce and mitigate our costs, our healthcare costs, our employer costs, everything like that. But we feel very strongly that it's also incumbent upon us to help mitigate those costs for our employees. So how do we face those challenges? How do we address those challenges? And then effective communication. I think that's the third leg here is how do you get the right piece of communication to the right person at the right time in the right mode? So those are some of the things that we tackle each and every day. Now, as far as addressing those, we take a very close look at all of our data. We heard about some of the carriers may make it difficult for you to get your data. Make sure you're working with those trusted partners. It is your data. Make sure that you understand it. So we take a very close look at our data to understand what is going on. And so in this case, we found that musculoskeletal, MSK, was a continually rising cost on our healthcare spend. It was outside of the top 10 there for a little while, but then it was inside the top 10, and then it was in the top 5, and then it was in the top 3. So we knew we had a challenge to address. We had to tackle this head on. And so we knew the other thing that we found is that we didn't take bets internally, but we kind of took bets, right? As far as like, all right, what population is going to be driving this spend? And so we kind of each took guesses and we said, okay, well, yeah, this cohort is probably more likely to have it, or this employee population or group, right? We have pilots who are sitting in a cockpit for 2 to 10 hours. We have flight attendants who are bending and lifting heavy luggage, helping our owners. We have mechanics who are working above their heads, turning wrenches, all of that. So we each took our guesses, and turns out we were all wrong. We couldn't have been more wrong. It was a universal need. what we found was that MSK does not discriminate. And then we needed to gain, so because of that, we needed to get creative, right? We knew that because we have this diverse population, we needed a digital solution, an easy solution that folks can do in their home. Folks can do in a hotel room, right? Our pilots and flight attendants are flying around the world in a different hotel room 6-7 days a week. They need to have a no nonsense, no frills, no fancy equipment needed, something that they can do in a small space to not only help reduce that physical body pain, but in some cases, we actually suggest to our crew members, use this as a prophylactic almost. Do it as a warm up to your day, to your shift, and do it as a warm down at the end of your shift to help improve your physical body pain as well. And then we needed leadership buy-in, of course. So if any of you are in the room, your organizations might not be agile. To use an aviation parlance at NetJets, we need a long runway sometimes to make changes. So with us, we know that about our leadership. We have to start planting the seed early and often. So with this solution, we started planting the seed about 12 to 18 months in advance, letting them know the financial impacts that we are having, the solutions that we're contemplating, and the reason why we need this solution. So we needed that leadership buy-in early and speak to them often. So we've identified the challenge and we know we need to address it. Now it's time for action, right? So we worked with our trusted benefits consultant. They were key in this. They really know us. We are very transparent with our benefits consultant. We want them to know not only us, the benefits team, but then our entire population, right? That way they can help tee up solutions that will be best for us. We have wonderful solutions here today. Go talk to them. Some of them might be a really great fit for you and your organizations, and some of them might not. That's okay, but having that trusted benefits consultant who can help kind of guide you and navigate you is key. We also rely on our consultants, of course, just like you, to help us independently validate the data, right? We needed them to help us validate the projected ROI. And then as far as implementing it, these types of solutions, NetJets takes the approach of launching it on a mid-cycle rather than doing it on a 1-1 in this case. We tend to do it on a mid-year cycle. That way we can do a big communication splash, really put a lot of attention onto it. The other thing with our implementations with these types of solutions is we'll do it in phases, or we tend to do it in phases, right? We start with phase 1, do a full cycle on that, gather the data, validate the data, see what's happening, what's working well, what's not working well, where do we need to shift, and then move on to phase 2. That also makes it a little bit easier for our leadership, that financial buy-in, right? Instead of doing this massive 4-step project all on day 1 that's going to cost however many, millions of dollars that the CFO is going to say, we can kind of add it and drip it on a little bit more slowly. So it's easier to implement that way. And then as far as socializing the benefits, so of course we worked with this solution. They had a wonderful communications campaign set up, so we built off of that, customized that. But then I think we felt it was really key to work with our internal communications team, where any time that this solution was going to be doing a campaign, whether that's a mailer, an email, an on-site, or whatever the case may be, that about 7 to 10 days in advance of that, we were doing our own communications campaign through the intranet, through newsletters, through awareness, saying, hey, this is coming, be on the lookout. It's a really awesome benefit. And in this case, oh, by the way, it's free, go sign up. So, right, doing a lot of priming of the employees to know that this is coming and be on the lookout. Something else that was kind of interesting for us that we've learned through the process is that all of our pilots and flight attendants have to go through regular recurrent training. So they have to come back in to go through training. And the benefits team, we've been really honored to carve out a piece of time in each of their training schedules. So on a weekly basis, one of us from the benefits team is going to present to retrain them on benefits, right? How do we retrain them to understand their benefits, to best utilize it? And so absolutely, we're taking time to talk about this solution and re-socialize it. And what we found was after quite a long period of time, we weren't getting the increased utilization that we expected, right? We were hoping like, all right, yeah, we're talking about it every week. We're catching different folks at different times and things like that. We're going to start seeing the utilization increase. And we did to some extent, but we weren't seeing it what we expected. And so another thing, by having this trusted partner, we have an amazing account manager with the solution. And she's really taken the time to get to know us also. And we had shared with her, but that at these recurrent trainings, we pass out swag bags bags, some NetJet swag and so forth. So she had the brilliant idea of saying, why don't we do a custom URL insert card into those swag bags, and then we can track logins or signups using that custom URL. So I think we're hitting about 6 months right now. So I'm really excited to start to hopefully see some data on that over the past 6 months. And then lastly, open enrollment, right? I know you all communicate during open enrollment, but how often are you doing it? How many modes are you doing it? Is it in person? Is it recordings? Things like that. Mailers, online, intranet, newsletters, all of those things, right? Finding the right mode to capture the person at the right time when they need it, how they can digest it is key also. So we absolutely highlighted this. And we saw, percentage-wise, we saw a huge increase in our utilization in the 4 weeks surrounding open enrollment because we did a specific campaign just for this solution, as well as other solutions in our ecosystem. But we saw a really great increase there. All right, so on to some really phenomenal outcomes that I'm very proud of. So in the upper middle square, 51% reduction in pain. So after 90 days of going through this program, our population, so 12 weeks, not a long commitment, folks, a 50% reduction in their pain. And this is self-reported. The next one right below it, middle bottom, 52% reduction in intent for surgery. So somebody going into the program saying, yes, I need knee surgery, I need hip surgery, fill in the blank. But then again, after doing that for 90 days, just 12 weeks, consistently, that reduction is half, right? The intent for surgery. So a couple of things with that. As the employer, that's good news for us because then that's a potentially, hopefully, avoided high-cost surgery, right? If they're in the hospital for 1 to 4 days, that is huge. So that not only impacts us, but then it also takes the employee out of work, right? So what that means then, what I see on this is that our folks are going out for surgery, then they're on short-term disability. They're only earning a fraction of their income. They're out for another 6 weeks doing rehab, et cetera, et cetera. So they've lost their income and we've lost that productivity. So if we can help give them a no-cost solution where they're able to remain working, making 100% of their salary, and we still get that productivity, that's a win-win there. And I know I'm running out of time here. So the last two things I'll mention, upper right corner, this is near and dear to me, but the improvement in mental health. What this says is that the physical body pain that we are all holding on to, think about yourself right now. How much does your knee hurt and your hips hurt and your low back and the rest of us that sit at our desks and we turn into this little gremlin, right? And my back and my shoulders, it hurts. What this says to me is that if we can alleviate that physical body pain, it can absolutely help improve our mental health as well. Fun fact on all three of those, the data gets better the longer somebody stays in the program. So this is just 90 days. This is just one set of the program. The longer somebody stays in the program, the better our statistics get. So I love that as well. The more you do it, the better you get, right? I've heard this theme over and over again today. And then lastly, bottom right-hand corner, great ROI, and then customer satisfaction. We wouldn't be doing this if our folks weren't pleased with it. So this is our members reporting on this. And then side note on these customer satisfaction. One of my favorite things about my job, and I hope it is for you too, but anytime somebody takes a moment to email me a compliment about a benefit or a solution or whatever, like that just makes my day because they took time out of their day to praise it rather than complain about it, because we all get that 10 times out of, 10 out of 10 times. But we've had a couple of compliments about this solution, specific to this solution, where the member wrote like 3 paragraphs and they were just effusive about how I was going through this time in my life. And then I got the mailer from Hinge Health and, I gave it away. But that's okay. I'll give it away here in a second. I got the mailer and it was just at the right time. And I talked to my doctor and I went through the program and now I'm doing better and da-da-da. And I actually thought that I was being punked because it was so well written. I thought it was AI. Like I thought somebody sent it. So I thought one of my department colleagues or something sent this to me to kind of like pull a joke on me. But no, in all reality, our folks are so pleased with it. So really pleased to be out here and check out Hinge Health in the back. Thank you.
We're going to take a few questions from the audience, but I'm going to start with questions of my own before we look to the audience for those questions. What I kept thinking about as I was listening to your presentations is what Jesse talked about in involving key stakeholders. So I'd like to learn a little bit more about how you involve those key stakeholders on the front end, maybe some lessons learned, maybe some stakeholder you maybe forgot about and then maybe paid the price after implementation. Any words of wisdom you can share around that involvement?
I'll walk away that I'm never going to forget. Thank you, Jesse, we need to do a better job. NetJets, we need to do a better job about holistic involvement. We, of course, involve finance and treasury and, executive leaders and so on and so forth. We need to do so much better. So I'm going to walk away from today that's going to be a lesson learned. We have learned through the process, though, that we need to do a lot of communication. So one big thing for us is I talked about it. We have folks in the hangar. We have mechanics. They have, I think, 4 shifts. And the overnight shift is the largest shift. Long story short, because that's when our planes are down. Most people aren't flying between 10 p.m. and I think it's like 5 a.m. or 6 a.m. or something. So they can work on the jets at that point. So they have the largest crew. I don't work third shift, but I need to work third shift. And so we take turns on the team going out there to the hangar and setting up a little table or a little room or something like that and inviting folks in and talking to them about our benefits or doing highlights and things like that. So we learned that kind of lesson just organically.
I think for us, luckily, everybody saw the benefits, right? So our CFO was on board, our head of HR, our head of business. So everybody, we involved the right people, but it was an easy sell, right, from that perspective. When we got to procurement, it got a little bit worse, but overall, everybody saw the benefit that this would bring, and even the return. So I think luckily we involved the right people, and everybody was in it. So.
Yeah, I guess I'll take a slightly different angle just because I talked about, having leadership back in is so important. But I think one thing that was essential for us is that we started holding what we called vendor summit. We're just we'll say disparate vendor partners. And so a lot of different vendor partners. And so ironically, our first one was on February 14th. So we called it the Vendor Summit Day of Love. And I don't think they entered, not all of them enjoyed that. But what was so enlightening for us is that, we have our administrator, we have, our PBM, TrustleTree was there, and a number of our other vendors, and say, okay, well, what about for diabetes? Who's on first there? What vendor should people? Everyone raise their hand. So it was so enlightening for us just to find out. Well, it's hey, we do that, but we also do that, and this vendor over here, we do that too. And so what we learned out of that, one, is that enlightenment, but then two, we actually created rules of the road because we wanted to leverage whoever had kind of the best relationship. Make sure that the member isn't being mailed or called by multiple vendors who could service diabetes or cardiovascular disease or whatever it may be. And so that was certainly an enlightenment. And so while not maybe as direct stakeholder as leadership, absolutely stakeholders in the success of the plan, and that did continue on, and we saw a lot of value from it.
Well, and I think that's a great point. Like any solution can't exist in a silo. There's other partners potentially that should be working together to make sure that the employee is getting that whole body care. So Adu, Jackson, any additional insights that you can provide on how you get those vendors to work together?
Yeah, I think for us, at least, again, the ecosystem, we try to do these fairs as well. I mean, we have the vendors communicating. For us, it was really connecting lives with the TPA. And also giving all the information that we need for them so they can link and refer everybody. I think right now we are going to the next step about, crossing the data. So now we want to get the lives data to cross with our TPA and see, how this is working. But again, it's just having, all the vendors open to this type of conversation and connection. And I think I see more and more with our navigation provider also. They have now their preferred partners. It is a program that they started a couple of years ago, based on our feedback to them that, hey, it's so much easier to get, a new vendor through your contract just with an amendment than going through this crazy procurement process for every single, vendor. So that I think it helped a lot as well.
And I'd say for us, NetJets, we also have a healthcare navigation, also vendor partner who is entrenched in all of these. So we make sure that all of our partners are playing nice in the sandbox. So we make sure that we are working very closely with all of them. One of the ways that we did it with this solution is we created custom referral cards that then we shared with this navigation solution. That way their care coordinator representatives could then refer out folks when conversations came up, or more easily kind of share out this kind of referral card. And that seemed to work really well. Something else that we do internally is that in this case for MSK, so many leaves of absence are surgery related or body related, knee surgery, hip surgery, right? We have an aging population. So we did a lot of cross-pollination and cross-education internally with our leave of absence team, with other teams and so forth. We have a shared service, like an HR shared service team as well, right? Training them up on keywords, things to hear, things to say, and then appropriate referrals. So yeah, really working on that. Just education is, if I had to distill it down to one word, and communication, 2 words.
Right, for sure. So one of the things I learned in speaking to our 3 gentlemen before today's session was in terms of participation, they're not using the traditional carrots and sticks, where, a few years ago, I think all of the employers or most of us were taking that approach. We were tying participation to healthcare premiums and offering other carrots and sticks. So I'm really curious on how you're able to get that type of engagement without throwing out the carrot or penalizing people for not participating.
Yeah, we have no incentive. It is just strongly encouraged and highly educated. We try to just get in front of our folks as much as possible. I think I'm probably turning into a broken record, so I apologize. But yeah, we steal the phrase. It's not our phrase, but communicate 7 different times, 7 different ways. And it feels like, to me, I'm like, didn't we already talk about this? Like, come on. But not to that person or not to that team. So yeah, just communicate.
Any other words of wisdom?
For us, it's a very little, right? I mean, we decided not to do it at the beginning as well, to see how organically we could, engage with people. There were some campaigns that we did something, tried to incentivize people to go and do it, but with smaller amounts, or at least a raffle for something, right? So it's not everybody gets something. You get a chance to win something. But yeah, sometimes we need to do that. But we were kind of, okay, let's try organically to see how this is going to go to evolve. And again, luckily, we are in a good place.
And I'll be just quick and really kind of it reinforces the points you've already heard. For us, we also have the opportunity to go to a lot of different member meetings. So I think just that reinforcement, and like I said, before, be visible, not just to reinforce messages and communicate and talk about benefits, but I promise you, being visible kind of takes the veil away. People understand, hey, you're real people. You're not just there to deny claims. And so I think there's a lot of reinforcement there, but it just, to your point, Jackson, the 7 and 7, the communication really never can stop. As much as you'd like to say, okay, we've communicated the heck out of it, everybody knows about it. You're going to find members who are like, well, I didn't know I had this benefit. So it's just kind of never ending, but it's all for good purpose.
Sure. So we've heard a lot of great things about the solution that you put into place, but some of the best learnings we have is when we stumble or when we come across a roadblock and we figure out how to get around that. Do you have any specific examples about how maybe you changed course or you dealt with a roadblock that got put in your way?
Yeah, I mean, I'll go first. I mean, I think for ours is kind of some of the writing on the wall. We waited too long to take kind of our data back. As I said when I was discussing, just our data was kind of held and used by our administrator, and it's for us to get data back in our hands, and we use an outside vendor. I mean, the learnings we got were phenomenal. It just allowed us to change course and redirect in a much more kind of real-time manner, and that was always our goal. The goal was, how do we get to real-time data, and how can we react to it? You can't do it by the second, but it sure beats having to wait 6 weeks for an answer from your carrier about your own data. And so I think that's one learning, is that we should have jumped on that much sooner than we actually did.
I would say for us, it was really trying to find the right balance about the communication. I think in some sites, people said, hey, you guys are communicating too much, right? Why you are focusing so much on this vendor, not necessarily on the others? Because it made sense, right? But so for us, it was really that. And I think, the HR field, I think it's really trying to get their engagement. In some locations, we were not able to get, as much as we could. So this, I think it was one roadblock in some of the sites. So trying to get better there.
And I don't know that we hit any roadblocks per se with this solution, but I'm definitely going to take away, I know I mentioned already, but more buy-in, more advisory board or more ERGs or whatever it is, making sure others are involved will be a key takeaway for every other implementation moving forward, I think.
Awesome. And it looks like we have a question from online.
Yeah, so there's a comment from Kim Dwyer. At Advocate Health, we would host an annual vendor summit where the various point solutions defined and developed collaborative relationships for warm transfers. So bringing them all together to try and get them to play nice. And then a question for Edu. How did Teva determine the 5-site 2-year pilot group to start with?
So we have sites in different states, but in Florida, I think it was the most diverse population that we had. So we decided to start there to see if that would be a factor or not, right? So that's why we decided to go. And it was also diverse in terms of population, but also there was an R&D site, there was a manufacturing site. So again, we tried to focus on different types of population that we had. That's why we decided to go there first.
Thank you. Any other questions from the audience? Oh, we've got one in the back. Paula, do you mind grabbing a mic? Oh, Mark's got it.
Thank you. Excellent information from all of you. Thank you. Cameron, for you specifically, one of the points you mentioned was leveraging the patient-doctor relationship. And we believe that's really important, but sometimes we struggle to ensure that from our partner, there's a way to get information to the doctor. Can you just expand a little bit upon how you all did that?
Yeah. So it's actually, it might be more of what we tried to take away. It actually did. And so I think a large part of it was just having an understanding and appreciation of that. We looked at ways where we actually, which unfortunately never got off the ground, but, could we, incent providers to, hey, help us get our folks into the various programs we have. That's something we did. But then we looked a little bit more closely, as an administrator has a lot of obligations and they need to send out this, they need to send out that. And we looked across all our vendor partners to say, hey, what are you sending to doctors potentially? Largely it was centered around Aetna. Are there ones that we can peel away that just aren't needed? Our medical director, who was kind of my right-hand man, he talked about when he's practicing and when he would get faxes that were unrelated to, hey, we need this approved, or this is relevant to your patient care, he'd throw it right in the bin. And I'm sure a lot of you have come across, I think it's more old school. Hopefully it's gone away 100%, but a lot of vendors count, an effort of communication as an engaged member, which, come on, that's not at all. So I think for us, was having that understanding and then pull back where we could to say, hey, don't bother faxing them about your program. I mean, the other one, and part of me, I'm going a little long, but it's when CVS would be like, hey, we're going to have our pharmacist engage with the, who's gotten into a pharmacy that a pharmacist has time to talk to a program, that is important, no doubt. But you can't place that on the pharmacist. So things like that, we pulled back to say, hey, let's let the pharmacist do what they're good at. Let's let the doctor do what they're good at and get the hell out of their way. So there you go.
I guess a follow-up question to that is, you mentioned that 72% of your folks did not have a physician. Are you doing anything to change that?
Good question. I think really through lives, because again, we cannot reach out to say, hey, you don't have a PCP, right? I mean, so that's the only way that we have to go. We have been sending some communications even before lives, but we don't feel that it was really effective to reach out to this population, not really want to do something. So again, through them, I think it is really our channel to get people to have those
We'll be looking for your updated stat next year at this time. So any other questions from the audience? If not, just a speed round. We'll give you 20 seconds each. If you were to give one piece of advice to the employers in the room, and it doesn't have to be related to this specific solution, just in your wide knowledge of employee wellness, what would you recommend to our employers?
I'll go first. Talk to all of these vendor solutions and partners today, get to know them, understand what it is that they're doing, and start to think through, all right, what's going to be good for my population? Start putting that lens of how's that mechanic going to appreciate that? How's that flight attendant going to appreciate that? Just start getting to know the landscape and then start thinking through what is it that are your goals. That'd be my advice for today.
I think to me, it's really take the risk, right? I mean, in the sense that I know that we love benchmark and say, oh, okay, let's see what the other companies are doing about this and that. But somebody has to be the pioneer or the first one, right? So I think to me, it's really that. I mean, try to find something that it's really important for your population and go for it. And again, there is a risk, but there is also a reward at the end.
And I'll try to go real quickly here, but I would say just be relentlessly persistent. We all as benefit folks are an awesome conduit to, the benefits and to our members. In lieu of us, who knows where they'd be. And then likewise for, kind of plan level, be relentless in seeking out new solutions, ask questions, try, don't accept the status quo.
That was phenomenal. Thank you so much. Let's give our panelists a round of applause. You guys want to just hang out here just for a moment? We'll close up. Before we break for lunch, though, I do want to have a word from another one of our sponsors, Talkspace.
Talkspace mental health benefits are trusted by experts and loved by employees because we offer convenient, clinically proven care for many mental health needs. The possibilities include virtual therapy with a licensed therapist through video or voice sessions, messaging therapy, or a combination. Talkspace self-guided programs designed to prevent mental health conditions by teaching mental fitness, stress management, and more. Talkspace psychiatry and medication management, and teen therapy for dependents 13 and up. We'll partner with you to design a benefit offering that suits the needs of your people and your organization. You may offer Talkspace as a standalone benefit or in combination with employee assistance programs. Talkspace mental health care works. 80% of people report it as or more effective than in-person therapy, and 70% experience improved anxiety and depression within 12 weeks. Talk to Talkspace about how to provide the right mental health support for your organization.
All right, and Talkspace is here as well, right around the corner. Did anybody attend our mental health training that we offered last year? Show of hands. We offered it both of a virtual as well as a in-person session. We partnered with Talkspace to do it last year, and we're doing it again this year. They are very generously offering us the opportunity to give this training out to our employer members. So you're going to be hearing more about that in February, and we will be offering both a virtual and an in-person session. You might want to mark those dates on your calendar, May 29th, as well as the in-person session on June 24th. We are going to break for lunch. As you break for lunch, again, please take time to visit our sponsors. We have our MHPC, MBGH booth in the back as well. Mark and Lois are there, so please come say hello to them. We've got some fabulous prizes, as you know, so fill out that prize card, turn it in at the registration desk, and we will see you back here at 12:55. Enjoy.
All right, so I think we've had a lot of good information shared today, starting off with taking care of yourself, putting on your oxygen mask for yourself before you're taking care of others, engaging those key stakeholders. And then that was reinforced with our three panelists talking about their important point solutions that are really making a difference. But kind of also circling back to how including your key stakeholders along the way, putting those in place. So we're going to build on that. The theme of today was power up. And I think, you may be misled thinking like, what are the powerful employee well-being strategies that we need to be doing or that are available? And really, it's not about doing more and more and more, but it's getting more out of what you have in place and connecting with the right people, communicating, engaging. We're going to talk about that with our two panelists right now, but engaging people more in what is available. So before we get started, I am going to share another sponsor message. So Good Path.
When we feel bad, we tend to focus on that. I hear stories like, I have low back pain, and I'm going to try physical therapy, or I have anxiety, and I'm going to try meditation. But the truth is, these are very complex conditions, and one treatment approach is rarely enough. Take back pain, for example. A sore back may also be due to poor sleep, distress or anxiety, or even a bad diet. So to resolve back pain, we must resolve the contributing factors as well. And that's what Good Path offers, integrative whole person care. It treats the person as a whole and aims to resolve these contributing factors. And this approach leads to much better outcomes than a single solution approach. GoodPath does this by offering multidisciplinary care, personalized treatments, and a dedicated health coach. Employees love the personalized care, and employers love the reviews and the results. Learn how GoodPath can help your team.
All right. And thank you again to all of our sponsors. GoodPath has a table out in the exhibit hall. So if you can grab your phones again, one last poll. I think this is the last one. What are your organization's 2025 health priorities? And this is a check all that apply. We recently did the Pulse of Purchaser survey, which a lot of you in this room probably completed that. We've shared those results. Again, just kind of looking to get more insight into what your priorities are for the year. Great. Thank you for your responses. So engaging members in the existing program. So what we just talked about, communicating 7 times, 7 ways, and mental health substance abuse, which we have our next educational forum coming up in March is focused on mental health. So hopefully you'll join us for that one. So in speaking with our 2 panelists here, I'm going to introduce Leah Halsworth first, which you already got a little teaser earlier from Leah. But as we were preparing for this, we just had such a genuine good conversation about what they had going on at AbbVie. And so we decided to turn this into a fireside chat and not kill you with more slides. So you get a reprieve from all the slides. And Leah has been in the health and well-being arena for over 30 years. The well-being programs she's managed have been recognized by the Business Group on Health, American College of Occupational and Environmental Medicine, the Center for Disease and Prevention, and others. She's presented internationally, nationally, and locally. And her power-up photo here, which we have to take her word for it, is she's the one in the front middle, I believe, with her head underwater, swimming about 2.1 miles in Lake Superior, so cold water. So Leah, welcome. And if you want to tell us a little bit more about your photo here.
There we go. Better? All right. So I was loving hearing about how important water is because it is obviously in my world as well. So the year, I would say probably it was the most exciting time that I had with open water swimming was a couple of years ago. I did swim competitively through college. And so it's always been kind of part of my life. And I always feel a lot better. And I've always lived near water. So there's just, I don't know, something in my soul that does that. I also just to appreciate cold baths. That year I did an escape from Alcatraz, jumped off a boat near Alcatraz and swam back to San Francisco. The water temperature was 62 degrees, which was about 5 degrees warmer when they told us. So that was like, yay, blessing. So yes, you can escape from Alcatraz. People do it every day. And then what was next was it was a 2-mile swim in Lake Michigan, just kind of north of here. It was just that temperature water was 60 degrees. It was supposed to be 72, so nobody had a wetsuit, so cold. And then this picture is from a swim that I've done 9 times, and it's up in Lake Superior. It's from a little town called Bayfield, Wisconsin, and you swim to one of the Apostles Islands. So there's about 400 crazy people who do that. And it's a lot of fun. And you really just try hard not to think because actually Lake Superior has the deepest water when you're swimming and you're realizing that it's like 300 feet deep. And I was really glad to have a pink cap because the guys had a blue one and I figured they'd find me faster if anything happened. And, and you just kind of keep trucking along. I think the thing that's unique about that swim though, is that it's a straight shot. So you don't even know where the finish line is. And you just have to kind of just pull on your inner dory and just keep swimming. And sooner or later you see the finish line and you're done. So
excellent. All right. And I think based on what Mark was sharing earlier, you're building up a lot of healthy negative ions in doing these swims as well. So, all right. So you've had the AbbVie Vitality Program for many years. Tell us about the evolution and how your definition of well-being has changed.
Yeah, so one of the things about AbbVie is I do sit under Total Rewards. So Total Rewards for us is compensation, benefits, and well-being. So I like to think that we're a three-legged stool. I will tell you at times I feel like my stool leg is probably not as long as everybody else's, but really, we're really trying to grow a lot more. So a couple of years ago, we took away incentives. We used to have a commercial portal that went away. We don't do points anymore, but because we really wanted to focus on the culture, and we really wanted to say that how we amplify and we contribute to AbbVie's culture was more important than somebody that's keeping points and that type of thing. We have a lot of homegrown programs, and so we really never saw. Actually, we've seen some increases in some of our, in our programs. We really haven't seen a decrease in what we've been doing, which really kind of is a testament to AbbVie culture. But we were very, very conscious about how not to just give somebody an app or something else to do, but how do we get down to the root cause? What does that look like? And instead of, I'm like really, really stressed, here's a meditation app, and a meditation app is really good. But if we don't start to look at the root cause behind that stress, it's just going to keep propagating and keep growing. So, what do we need to do? So we really wanted to sit back and really look at that a little bit closer, and to really understand those unique things that are happening, culturally at AbbVie. Organizational factors is what we call them, but we also know there's individual factors. So I know earlier on we talked about, what happens at home comes to work, and what happens at work comes home. And we wanted to make sure that we were starting to address those issues in a way that really is supportive of our employees as well as our culture.
Thank you. So you're really pulling in your people leaders in a different way. How is that different than it's been in the past?
Yeah. So I think in the past, we've always focused on those individual well-being. It's like, how do we make sure people are taking care of themselves? That is the foundation of who we are. We'll continue to do that. But as we started to look at things a little bit more, and as the workplace has really changed over the last few years, that feeling that, what's happening at work is, what happens at home comes to work, and the reverse of it true, we needed to make sure that we were equipping our people leaders to better understand what those factors are and how to have conversations around them. So that was kind of a big initiative for us. It's like, how do we do that? What do we need to do to help educate our people leaders? Because so many of times you become a people leader because you are really good at your job, but nobody ever told you to have a people leader. We were also hearing when we talked with people, they're like, ooh, I don't want to have that conversation. What if they cry in my office? Or what if I make it worse? Or how do I do that? And instead of not recognizing what's happening or what's going on, both personally or professionally, because that person is there, they're not having those conversations. And so we needed to make sure that our people leaders innately knew that, part of being a people leader innately is that they're important. They play a critical role in the well-being of their employees, and that it has to be addressed. It has to be, you have to have those conversations, or again, we are not figuring out what that root cause is. So we had to figure that out. And what did that look like? And how do we communicate that? But then how do we not scare our people leaders? Because AbbVie's a high performing organization, and there's goals, and we're very goal driven, and we have things that we really want to accomplish. And then now you're telling me that I need to have conversations with my people. And what if they need to go on leave, or what if they have to have some workplace flexibility? And then how am I going to meet my goals if my team is not here? So how do we balance that tension as well? So what do we need to do to support those people leaders, and what does that look like? So that's really been our focus for our last 12 months.
Yeah. And people can't be scared of those conversations. So what did you do to get started with this training? How did you craft the approach? What were your initial steps?
We talked to everybody. It seemed like we partnered, and my team laughs because I always talk about we need to make friends, and we need to be able to find and understand what's going on in the organization. So we partnered with our culture team. We partnered with our ED team. We partnered with employee health and safety. We partnered with employee work relations because they hear everything. We have, partnered with BHR. We talked to our general managers, and we just start, and we worked with a consultant too to help us. We had a half-day workshop. It was a multi-functional global session. So that meant we had people from commercial, we had people from operations, we had people from R&D, we had people from HR, and then we also had people from our aesthetic line. And we just found out what was going on, and had those kind of conversations to see what's happening and where do people need that support. And then we did all the stakeholder management. We talked, we listened, we revised, we talked, we listened, we revised. We sent it out to our advisory board. I have a global advisory board. We sent it by them to ask them, does this work globally? I'm like, am I offending somebody? Is this the right words to use? Can we use certain words on a global scale? And then listened, revised, did it again until we finally got to a point where we felt like we were really good, took it to our senior leadership and shared kind of what we were doing, and then started to implement.
Great. So what does that training look like? How are you delivering this message to your people leaders?
We have a 50-minute webinar. I do that with our on-site mental health therapists. It's always nice when you're talking about how to have conversations, to have somebody who has conversations and sensitive conversations on a regular basis. So we have a lot of scenarios and role planning during that. We have takes 20 minutes like module that you can take if you can't do that. And we have what started off as going to be a quick guide of all the well-being resources. It ends up, I hate to say it, I think it's like 12 pages or something like that, but it's all online, links available. So it's everything that they need to know is in one spot.
Great. And so how are you working to create a safe environment for those people leaders to be successful with this information?
Yeah, so we started really working with our people leaders, and we've been doing, kind of, I would say, a roadshow. We're continuing to do that across the board. But we really wanted to give the people leaders resources. Like, how do you have these conversations? So a couple things, like a couple key points that we did that is we recognize we flat out say, being a people leader is complex, but you don't have to have all the answers. What you do need to do is being able to open up to have those conversations. So, we talk about then how do you have that conversation? Because again, so many times you just don't want to say anything because, I don't want to make it worse, or I don't want to make it this really bad kind of thing. So we have an acronym. We are really great at acronyms at AbbVie. But we have REAL. It's called, you need to have real conversations. So they're respectful, empathetic, authentic, and listening. So it really helps to give our people leaders just the step-by-step about how do you have this conversation. We talk about having I statements, it's coming, I noticed, and then we go through scenarios and 5 different well-being moments that your employee may come and talk to you. Give them scenarios and things to say across the board for all of that. And just give them a little confidence and get that training. I'm like, okay, it's okay to have these conversations, and this is how to do it.
So are they actually being asked to role play these things? People, that's like a scary word, right?
Yeah,
You're role playing these in the training?
Callie and I do all the role playing, so they know that they're pretty good. But it's very interactive, and some people come up and they say, we'll get comments about, well, this happened. How would you have this conversation? Or I didn't know how to do that. So we do work through those role playings with them. We can.
Okay. All right. What feedback have you received internally, either from HR functions and from the people leaders?
So what we really heard is that we never thought about well-being in this way. Most of our people leaders never thought that they play such a critical role in the well-being of their team. They also really didn't realize how important it is in terms of helping them meet their goals and the overall productivity. So the link of is like, if we're well individually, we have well teams, we know we're going to have a more productive organization. So that's all been kind of new. I've also heard that REAL works really well at home with your spouse or your partner when you don't know what to say and you need to have a conversation. So for us, it's really broadened out what well-being is. I think a lot of times they think of it as that traditional kind of more wellness of nutrition and exercise, and we've always been really good at that at AbbVie. But this has really broadened us out a little bit more about what, how important well-being is and how much of it is a cornerstone to a strong organization.
And are you getting stories back from your people leaders?
Yeah, we are. We've had one. We have one. It was interesting. He was a brand new supervisor in Puerto Rico, manufacturing plant, kind of got there because he was really good at his job, and now he's a supervisor on third shift. And, it's a tough time to keep and retain employees, right? And, it's like, okay, how do I get off third shift? What do I need to do? But he started just kind of being very informal about it, of going out and saying, hello, good evening. Do you have questions? Is there anything I can help with? And just getting to know his team a little bit better and having those real and then people started to come to him. He started having real conversations, and he's really seen, increased productivity and less attrition. So he's been able to maintain his team a little bit, longer than what we would expect. So, that was just kind of was exciting for us to be able to hear that. We also do hear that people are starting to use it during, like, when it's time for performance reviews. If the performance review isn't really good, well, then how do I have a real conversation about that? Or how do I have real conversations before that performance review? But yeah, and then we've also heard, like, how are you going to keep this going? Because, that's always a big one. It's like, how do you make sure that this stays forward?
Mm-hmm. Great. Well, thank you. I think you did prepare just a few thoughts about lessons you have learned throughout this journey. If you want to walk us through these, and then we're going to save questions till after we talk to Brian, and then you can ask questions of both of them.
Sure. So one is, know your stakeholders, talk to them, listen. Listening's a really big deal, and do it all again. I will tell you, we started this project. This was not anywhere on the roadmap of when we got there. That was not kind of where we thought we were going to end up, but we were excited when we got there. Be relevant to your organization. What works for AbbVie may not work for anybody else. So you always want to make sure you're living into that culture, and you're getting those stakeholders and making sure that you sound like the organization and not somebody that's just coming in from the outside. The other one is what's in it for me? And that's when I think with our people leaders, they're busy. They're like, their jobs are complex. And now you're saying, I got to do this too. So really kind of reassuring them that, what? You need to have the conversation. You can point them to resources, but they're still adults, and they need to be able to take responsibility and to kind of help work through the program, or what you need, or what needs to happen. So again, what's in it for the manager? And, the end result is that the research shows, there's so much research out there right now that shows that if you are really working with your teams, and you're having these kind of conversations, and you're driving towards the, one common goal, and you're transparent about what that goal is and how you're getting there, everybody's going to work a little bit better together, which I think we all need to, it's an ultimate goal for all of us. Storytelling in scenarios was really important. Callie and I are not natural actors, and that was really hard. But when we got there, it was really important for us to be able to put it in real life situations for everyone. And again, the other one is that the program did start off with Wellbeing Essentials, and we had a lot of pushback because everybody thought, they were like, I don't need anybody to tell me I need to exercise more and eat better. I get it. I don't have time for it. But so we've changed the name. So it's really more along the lines of having real conversations, so that it kind of makes sense to what we're trying to accomplish. And then the sustainment plan, and that, how are we going to keep this rolling out? How do we keep doing this? How do we do this on a global scale is really important. And then, we want to make sure that we are relevant to all various audiences. As we've seen this grow, HR has asked for kind of a revised version of it, because we know HR directors and staff, BHR, they see everything. So we want them to be able to feel equipped, that they have the things that they need to be able to support. And then knowing your resources and really bringing up different resources. I will tell you, with EAP, we've been seeing an increase in our manager consultations and managers assist. Or tell people, leaders, if you don't know what to say, you can call the EAP, and you can talk to somebody who's going to be able to help you find the right words to be able to say it. And I think when we feel confident in what we're going to say and what we're trying to address, and somebody's been able to support that, it makes it a lot better.
Yeah, they don't have to have all the answers. They just have to be authentic and be willing to dig a little bit to help them connect to the proper resources. Yeah, fantastic. Thank you, Leah. And we'll be back to talk to you more. All right. So I'd like to introduce Brian Quinn. And Brian is Senior Global Inclusion and Wellness Specialist at CooperVision, Cooper Companies. I think if you wear contacts, more than likely you have one of their products in your face right now. Brian has been helping employees feel a sense of belonging at work along with building a supportive environment for their physical, mental, and emotional health for 12 years. But it's so much deeper than that. And talking with Brian, like, it's just so impressive, the work that you guys have been able to do to help people feel a sense of connection and belonging and vulnerability with each other. So Brian's power photo up here, he says what powers him up is when his passion and his purpose meet. And this photo represents his involvement to bring fitness and wellness to those recovering from addiction in his community. So you want to tell us a little bit more about that first?
I would love to. Thank you so much. So yeah, this photo right here was taken a few weeks ago. But about 10 years ago, I was walking, I'm from Rochester, New York, and I was walking downtown heading to my gym, and I met two people carrying all of this fitness equipment to my gym. I mean, they were battle ropes, they were weight plates, there was a bike they were towing. And so I stopped to help them and asked them what they were doing. And they said, well, we started a brand new grassroots organization here in Rochester to see if we could help people sustain sobriety. So this couple had been in active addiction and recovery back and forth. They kept meeting up at rehab centers and they started to talk to each other. Why can't we stay sober? What's the missing part? So they thought it might be wellness and fitness. So I'm talking to them on the street. I knew nothing about addiction. Now, most of my spare time is spent with people in recovery. But when I met them, I was so enthralled. They're like, do you want to join our board? And I'm like, I would love to. They're like, great, you're our first board member. And it was as easy as that. So, but what it taught me is there's power in community, there's power in vulnerability, and people being authentic as well. So that is a lot of those values are in my own personal purpose. So when my purpose comes alive, I'm just filled with energy.
Thanks, Brian. All right. So can you describe the evolution of your wellness program over the last few years as well?
Sure. So I think like probably most wellness programs, we started with physical activity, and that meant step challenges. And we probably spent a good amount of our budget on apps and programs that would lead our employees on, virtual challenges with pedometers, back in the day. And then it kind of morphed into some nutrition. And then we were at a conference, my colleague and I were at a wellness conference, and the leader said, raise your hand if you do biometric screenings at work. And almost everybody's arm went up. And he said, keep it up if you've been doing it for more than 5 years, and then more than 10 years. And people's, started to come down. And then he said, now put your hands back up if you've been doing them. Now keep it up if your employee health has gotten better. And we all put our arms down. And I'm like, well, we've been doing these screenings for up to 6 years at my company, and we've not even seen a tick in the change on aggregate level health of our employees. So we knew something had to change. And at the same time, we had an employee come see me in person. And she said, with vulnerability, she said, she was our biggest champion in everything we did. And then she kind of went MIA. And I didn't have the tools to ask her why she went MIA, but I noticed it. But she said, you want me to do a step challenge? You want me to eat my 5 fruits and vegetables a day? You want me to go get my preventative screenings? She says, I'm going through so much right now. I'm lucky if I bathe. I'm lucky if I can get up off the couch. And she started to share with me everything that's been happening to her. And as I started hearing more and more employees telling those stories, it was a majority of employees that were feeling that way and saying they just didn't know how to make that first step. Granted, it sounded great. The communications were beautifully branded. They knew what the results would be if they did it, but they just mentally couldn't do it. So the biggest transformation is we provide mental wellness, mental health into every single thing that we do.
Thanks, Brian. So you've also had more of a focus on storytelling and pulling in your leaders into that process. Tell us about that.
Yeah, so I was at another conference that my company was holding, and I was part of the planning committee for that. And as we were talking, one of the speakers pulled me aside. He says, you're a really great storyteller. And I thought that was a bad thing. And I was like, well, who are you? You know, I'm like, so I started looking, he says, no, you could transform culture through the art of storytelling. So what we started to do, we dipped our toe in that. We figured, let's jump on the podcast train. And we're an optical company, so we called it A New View. So we did a New View podcast, which you would call a webinar, but more people came to it once we said it was a podcast. And we would have someone from our leadership and hourly, maybe employee, come together and share on a topic. And the first one we did was on prevention. And we had a gentleman who talked about his prostate cancer and a woman talking about breast cancer. And the gentleman who was speaking was one of our CEOs. And the woman talking about breast cancer was an operator in our distribution center. So they had never met. They came together for this call, both shared their stories, find where there were similarities, where there were differences, but really to get the word out about prevention. And what we noticed is we did that and we had such a large audience and we couldn't understand why, but we really believed it was the different levels of employees telling their stories. So we did a whole thing on prevention. And what we noticed in the next 2 years, mammograms, preventative screenings went up. It's the first time we've seen it. We didn't see the big jump with men's health, unfortunately, but we did see it with the women's health. And that's led to future groups. So we now have a survivor group. So if someone is recently diagnosed, they know there's a network of people right where they work that they could talk to who are survivors of that cancer.
That's awesome. Less about promoting what you should do, telling them what they need to do, and more about attracting them to something that's impactful. So what are some of those other more personal topics that you've been able to dive into through this format? Because you've really covered a lot of kind of fringe areas, I'd say.
Yeah, very fringe and very specific. So we started with prevention and then it led right into suicide awareness. And we had one of our C-suite leaders talk about losing their grandchild to suicide. And we had another hourly employee talk about losing her brother to suicide. And we made sure with that topic, we had a professional at the table too, who kind of co-led the podcast with me. So we reached out to the community and we went to NAMI and we found the best NAMI person to come in from our local city to be that professional, to make sure we had the right information, the right prevention information, the right statistics to tell people on the call. But with those two people very vulnerably sharing their story, we had to date, our largest number of employees on that call. And then it's led to other things too, very specific things like mental health for your children, neurodiversity, Pride Month topics and conversations with our LGBTQ plus community. And we've had people come and talk about sleep. I'm trying to think that the long list of them, but we start to get more and more employees saying, I want to be a guest. And this is the topic I'd like to talk about. It's a problem, a good problem to have, and we're trying to work through that now. But what we did realize is the higher the audience would be from whoever our guests were, whoever our employee guests were. And if they were really well-known people, like people managers, we'd have a spike in attendance and re-watching post-recording.
And has there been any hesitation from your leadership, your senior leaders to share openly on these topics?
Yeah, it was a bit of a shift in how we did things with wellness and well-being. And we decided to start at the top. We did receive a few no's at first, but once the first two people went, and their feedback that it wasn't that bad, that we know what vulnerability is like. And when you are vulnerable, that we talk about that vulnerability hangover. Like, did I just share all that with, 13,000 people? And we had a leader talk about sleep apnea, and it was due to his being overweight. And he's like, do I really want to talk about that? But he did. And he received feedback from an overnight operator to say, I listened, I have the same exact condition. And because I didn't want to do the whatever the steps were, he said, the steps that you talked about, I thought were doable for me. So he went and did it, and he has now controlled his sleep because of this person he would have never met before.
Fantastic. So this storytelling approach kind of had a progression and took you to another type of outreach, this reverse mentoring. Can you talk about that?
Sure. So we know mentorship's a very powerful tool, and it led to post calls, a lot of mentorship opportunities. But what we're most proud of is our reverse mentorship processes that we have started. So we did neurodiversity. We talked about, we had 2 parents share their story of having neurodiverse children. And then that led to a reverse mentoring program where we had 15 employees who were identified as neurodiverse speak to leaders of the company in a 6-month reverse mentoring program, just to explain what it's like for them, how they learn, how they lead, whatever it might be. And it's people from all levels of the organization. So it kind of closes that gap between leadership and frontline employee. We've done it with our LGBTQ plus community. We have done it with several of our different employee resource groups. And we found that the reverse mentoring was the #1 way to create change and kind of start the culture or a shift in culture. And what we noticed is with the pairs of mentorships, and we didn't plan this to happen, but when they were done with their 6 months, they all wanted an action item that this pair would walk away with to help improve the culture at Cooper. And so then it's become just a regular routine for any reverse mentoring program that every couple or every pair comes out with an action item to help change the culture.
It's so awesome. Okay, you shared about one other program related to women's empowerment. You want to tell us about that one?
We did a New View podcast on menopause, and I was not the person to lead the conversation, so we found someone else to come in and lead that podcast. But we had 3 different women talk about different parts of menopause that they were experiencing or had experienced. And it was the first time we talked about menopause out loud. And we are 55% women populated, but we'd never broached the topic. And then that led to just a hallway conversation. It was all in one day. I heard 3 different women talk about having mom guilt. And they said, it's just so difficult. And then they were talking about the different ages of their kids. So what we decided to do was do a podcast on mom guilt, a new view on mom guilt. And we brought 8 moms together from newborns to grandmoms. And they came in to talk about what is it like to have mom guilt? How do you deal at work when you're here with a sick child at home or whatever it might be? And it started a whole community that this group of women now these group of moms get together now, and they have like a little support group at work. And we have different locations all over America, but they meet on a monthly basis and they can talk to people who knows what it's like to go through that mom guilt. And I'm not saying dad guilt doesn't exist, but it was just the topic at the time. And that's what we decided to take on. So there's been a lot of different support networks that have come up due to people being vulnerable and being open. It was actually harder to find the hourly employees to talk vulnerably. It was easier to get our leaders to do it at different levels. So it's relationship building trust, building, the right type of listening. Someone mentioned listening earlier, so key to find out who might want to talk about what.
Thanks, Brian. All right. So you have also provided kind of a summary slide here, if you want to give your key lessons learned.
Yeah, like I just said, trust is probably the biggest. And by building trust, and it's not just the one, I do host the podcast, but it's multi-people finding the right people to come and have the conversation. So building trust would be #1. I think it'd be really difficult to do, to go up to someone and say, hey, would you like to talk about this? I heard that you might have some experience with this. So it's really building relationships, building trust, and then just starting the discussion. We found that the easiest thing to do that seemed like the hardest thing to do was just rip that Band-Aid off and start talking about it, especially with mental health. and then find the best ways to get the most out of your stories. So that what I mean by that, I guess a different way to communicate is we do these podcasts. They're usually 40 minutes long. They can be watched over and over again. A lot of employees don't have 40 minutes. So what we do is we do in a nutshell, and we break it down to about a 5-minute synopsis of the topic that links to it. We also do 1-minute podcasts. So we do a 1 minute with someone from an operation floor that might want to talk about their story, but they don't want to sit on a 40-minute podcast, but they'll talk about 1 minute, what it means to them on a specific topic. So we tried to find as many different channels as we could to reach as many employees as we could. Multi-generational became really important for us. So we made sure we're doing our next one is going to be a cross-generational podcast. It's going to break people into random groups to talk about the differences in those 5 generations. And so we just wanted to make sure at the end of the day, what the bottom line of our wellness program is that people feel included, we're meeting them where they're at, and that they do have a voice.
Awesome. Thank you both so much. So we're going to open up to questions, comments from the audience. But while you guys are thinking and getting the mic to you, Leah, maybe share with us what's next on your radar. What are you guys tackling next?
So for next, with real conversations, we will be tackling to put together a version for our employees, because we want to make sure that they're feeling confident about having to go talk to their people leaders as well. So just kind of doing that. We are also, because of the work that we've been doing and kind of the evolution of our well-being program, we got to figure out who we are. We've changed, and we're not exactly who we were 3 years ago, or even 5 years ago. So we're spending a lot of time just trying to figure out who we are. What does that look like? We have kind of pillars or dimensions, and are those passé? Are they holding back our program because we don't fit within those pillars and what we need to do? So we actually have next week is a half day, pretty similar, multi-function, multi-cultural half-day brainstorming session to see where are we going, what's our next thing. We'll continue with our core programs, but workplace flexibility doesn't really fit as a program. People leader training doesn't fit as a program. All of our mental health work doesn't necessarily fit in a program. So that's our next thing to tackle, is who we are and how are we impacting the culture at AbbVie.
What's your new identity? Brian, what's next for you guys?
I think finding a way to keep things fresh. I'm sure we could all agree with that. We have some great programs do we want to keep repeating them? Do we want to enhance them? Whether it's a one-time campaign, a year-long campaign. So what's next for us is building more stakeholders, I guess, from the bottom up. So it's an area that we can kind of fall into neglecting how important that hourly employee is as a stakeholder. And we've noticed over the past couple of years, by involving them more, bringing them to the table, having them part of the strategy planning has helped a lot. But we have a lot of work to do in that. And so that's what's next for us, is to continue to build that important network.
Okay. Any audience questions?
Question for Brian. Where do you post these podcasts, and how easily accessible, and what kind of ecosystem is that in? And then second part is, who's editing those 40-minute podcasts down to 5 minutes? Whose job is that?
Well, the beautiful part is they're 40 minutes long. We do nothing but Microsoft Teams. We have no equipment. We don't even have microphones. We use the mic on Microsoft Teams. If the person wants to have lighting on their own, they could put a ring light on, but they're so bare bones. It costs us $0. We reached out to the community for experts. We have never failed to get an expert come to the table at no cost. And it's just by reaching out to people to see if they'd like to talk. Now, when it comes down to editing, they go out raw. We don't edit any of them. We start with branding, end with branding. But what we do to edit them down to 5 minutes is we found an employee that loves videography. So she does all of our editing. She's one of our overnight operators at our manufacturing site. And she's gotten the permission now to spend a couple hours a month editing these videos down. But Microsoft Teams is what we use.
Yeah.
Thanks everyone for talking about your kind of bottom up approaches that maybe need a little bit of work. And I'm curious how employee resource groups might fit into that strategy, kind of getting those employee directed initiatives rather than doing so much from just your teams, because it's a lot of work, and being able to spread that around a little bit. I'm curious how those ERGs might come into play.
That's a fantastic question for me because we are an ERG. So wellness in my company is an employee resource group. So we did that 2 years ago, and we have 5 employee resource groups, and we cross-section them all the time. So now that wellness falls under that, we were able to build a network of participants in the ERG. And then we found out what are their skills? What do they love to do? What gives them energy? And that's how we found this person who likes to edit videos. And so what we did is by moving over to an ERG, we now have, like when we did the Mom Guilt podcast, we went to the 4 ERGs and said, could you nominate 1 or 2 people who would like to talk about this and come to the table and have a conversation? And it was 2 or 1 people from each of our ERGs. So we rely on our ERGs wholeheartedly for almost everything we do. I'm just going to do a shout out. Go DEI. We're private, so I feel a little safer here.
Just kind of just echo that too, because we have liaisons between the benefits team and our ERGs, and quite honestly, quite a few in the benefits team actually sit on leadership with the ERGs. So it's a great way to communicate the programs, but they are also, now that you have those relationships, they're the ones that come back and say, hey, this isn't working. Or, right now it's like, what are we doing for neurodiversity? And we don't have a handle on it yet, but it's on our radar screen because they're the ones that brought it up and said, we need help. Or I can't get tested. How do I do? It's like bum, 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 bum. And we're like, okay, got it, kind of thing. So I think anytime you can tap into those ERGs and build those relationships, it's key.
Any other questions from the audience? Well, I know Mark says I can't multitask, but I know there's a couple questions over here. So I'm going to shift my attention over here to the questions online. I know one of the questions, though, that came up, Leah, online was if you could just tell us again what REAL stands for, that acronym.
Yeah, so REAL stands for respectful, empathetic, authentic, and listening. So whenever you're starting any sort of conversation, we always want to make sure that we're starting off with being very respectful, but remember that empathy part, because most of the time when people are coming to tell you, there's a lot of emotion. So how do we bring that I would say, you want to have that emotion there, but we want to bring it down so that you can have that good conversation. You also want to come off as being an authentic leader all the time so that you're there and you're supporting. But the one thing is we've got to listen. Don't listen just to solve the problem. Don't listen and have preconceived notions, but to take the time to really listen, because lots of times when people have a lot of that emotion, it takes them a little bit to get to that point. So let that evolve without interruption.
All right, so there's a couple other comments and another question. So just wanted to share some of the comments from Whitney Ayers. She said, we do in-house podcasts too, with an exclamation point. I can confirm that employees listen to their peers. So hats off for that. I love the reverse mentors. Nina Affert said, can Brian share information on this? I was feverishly trying to take notes, but would like a little more information.
Okay. So again, we use our ERGs. We house neurodiversity in our wellness ERG. It's called Mind and Body Wellbeing. And so that was our very first reverse mentoring program. So we just email our ERG members and say, if anyone is neurodiverse and wants to talk about it, share their stories, or have a family member who is. So that's where we start with our ERGs. And then we make sure we have enough leaders. Some of our leaders might have 2 people at one time, depending on how that is. But we do put the ownership on both of them. So we might have our CFO meeting with a third shift operator that they have to come up and figure out that schedule when they can meet. And very often they do. And we have a monthly follow-up after they've met, just a really quick card that they fill out. But it all comes from people volunteering and saying, yes, I do want to do that. I would like to tell my story. I would like to share more. So we did that. The one thing I did forget to say is we do mental health first aid training. And we've been doing it for about 3 years now. We only do it in person. We don't do it online because the vendor we use won't do it online. So we do it in person. I'm proud to say we have 50% of our 1,100 employees have gone through the mental health first aid training. And that's another thing that helps connect all these people. So when we get these large groups of people, we're always surveying them about their interests, their passions, their purpose, what gives them energy. And then, like you said, Leah, if you're listening, you can get those nuggets to say, I think this person might be really good for this reverse mentoring, or even maybe mentoring.
All right, just another comment. We have another employer who said they're leaning on the menopause topic also, very timely with the age of our employees. And then we have a question for Leah. I'm curious if you noticed any improvement in the health metrics of your employee population after eliminating the incentives of well-being programs and focusing efforts on culture, or how that transition impacted their overall health and well-being.
We don't measure. So it's never really been kind of a big push for us. It's always we do screenings, but it's coming back and saying, making sure that they know the right referrals. So when we think about our screenings, we do vision screenings, we do all the traditional blood work, but we also do the PHQ-9 on the back so that they know their depression screening, and then here's the resources to get where you need to go. So, but quite honestly, after COVID, we have seen a decrease in the number of people who are getting their screenings. So we're trying to figure out that one too.
And if I could just jump out that real quick, we have several people said it today. People are always listening, and we might not know who we're getting. We might not know who's hearing that final message. And maybe it's the 17th time we said it and the person's ears finally pick up. Just want to share, someone talked about getting a thank you email. Because of our reverse mentoring on suicide and mental health, I had an employee come to my office, and she was from our marketing area, and she slipped me an envelope, and it was her suicide letter to her husband that she was planning. She kept it at work so he would never see it. And she was planning and contemplating several months earlier. Due to that conversation that we had, and the two people that spoke, it's something just in her mind switched. And it took her about 3 months to share that letter with me to say, thank you. And so you never know who's listening. And it's so important that people, no matter how many times you've done it, do it again.
It's part of our jobs.
Yeah, absolutely.
Definitely.
Can I ask one last question? Great participation from our online folks. For anybody doing podcasts, do you have stats on how much engagement there is? And can associates listen to the podcast outside of the work network? i.e., can you listen on your personal phone and don't have to be logged into a work network to access the podcast?
For us, unfortunately, they can't listen to it outside the network. What we can do is we're putting them all on Vimeo. And once we have the Vimeo secured through our IT securities, then they will be able to watch them all at home as well.
Great. So I think what I hear from both of you is having real conversations about tough subjects is, where your wellness programs are headed and having a lot of success right now. I was just having a conversation with someone about how it's really easy to be a manager when you have good employees, right? When they're kind of self-sufficient, like a self-cleaning oven, and you don't have to do anything. But when these tough conversations come up and people need support, they have to be equipped and ready to handle the situation. So thank you so much for your insights. If you guys could stay put just 1 second, we're going to have one more message from a sponsor, Amazon One Medical.
People are the most important part of your company. They work hard, so it's important to take good care of them. And with One Medical, it's easy to do just that. We partner with over 8,000 of the nation's biggest and brightest companies. And when the pandemic hit, we were there to help keep their employees safe with 24/7 virtual care, COVID-19 screening, testing, and mental health support. And we'll be there to help your company through whatever comes next. That's care for who you want to be.
We have a word from one of our sponsors.
You'll get better when you're not blamed for a condition you can't control. You'll get better when your pain isn't minimized, dismissed, forgotten. We will never stop trying to get better. Because when medicine gets better, all of us can get better.
Thank you, Lily. And our next speaker is Sarah Bassler-Millar, is a long-standing colleague and friend of MBGH. Those of you that have been around for a long time know that her company hosted all of our educational events for probably 15 years before COVID. And then COVID kind of changed things, and we're grateful to have this wonderful facility. But you have a special place in my heart, Sarah. Sarah is a partner at Faegre. We just practiced this. Faegre. Woo-hoo! You all practice that. Faegre, Drinker, Biddle, and Reith. It used to be just Drinker, Biddle, and Reith and that F word. Oh, sorry. Anyway, I want to go back to your photo. Who is that handsome man that you are with in that picture?
That is my son, Dominic, who is now taller than me.
That's the way it is. Yeah. Let me tell you a little bit about Sarah. She's a partner at the company I just mentioned in their employee benefits and executive compensation group. She counsels employer plan sponsors and service providers on the design, implementation, and administration of health and welfare benefits, retirement benefits, and non-qualified plans. They have been a long-standing, and I wrote this in my notes. Here I'm saying it again, member of MBGH. Sarah is our go-to person on all things policy and legislation related to wellness programs. And early on, 15 years ago, at least a very long time ago, she was talking about employers as fiduciary. And we were still trying to figure it all out, and look where we are today. So we're so excited to have you join us. Let's welcome Sarah.
Thank you, Cheryl. It is so wonderful to be with you all today. I chose photography as one of the activities that energizes me, and that's what this picture is about, because I like attention to detail. I like capturing that moment, right? And it's good for what I do as a lawyer. Today, we are going to do a quick overview of where things stand in the wellness program world. We're going to just do a very brief refresher of some of the basics, because that context is important for what we talk about with tobacco cessation litigation. There's a lot happening in that space right now, and I want to leave you with a couple of thoughts about what to think about when you go back to your companies and evaluate your current tobacco cessation programs. What to expect from the new administration. You can thank them for why I was absent this morning. A little bit of change happening right now. A quick update on privacy and security issues. We're going to talk about GLP-1 drugs, weight loss drugs, and then mental health parity. I'm just going to leave you with a little teaser, because frankly, we could spend a whole day on mental health. And in fact, I believe MBGH will be doing that, right? All right. So wellness programs, what do we mean when we talk about wellness programs? It is everything under the sun. Some of these things are completely voluntary. Some of them are more mandatory. We've got that whole scale there. And a lot of different laws apply, okay? We've got disability rules. We've got non-discrimination rules. We've got ERISA. We've got the tax code, COBRA, genetic information non-discrimination. It's a lot. Okay. And they don't always agree. There's sometimes conflicts between those rules. So you have to keep that in mind when you're thinking about legal compliance for your wellness program. And three of the biggies: HIPAA, GINA, and the ADA. This is just real quick, high level, what each of those three rules say. We're going to spend most of our time today talking about the HIPAA area and a little bit about ADA, okay? What's important to keep in mind here is that depending on the law, it could either apply to the plan or it could apply to the employer. And depending on how it applies, that will have different implications in terms of things like who the authority is, the regulatory agency that can actually enforce that particular law. Okay. Getting a little more into HIPAA here. One of the big things that we like to think about or bucket for HIPAA is 3 different categories of wellness programs. The first category with participatory wellness programs, these are things like you get credit just for showing up, basically. It's the participation trophy of wellness programs, right? These are generally not going to be subject to the rules that I talk about on the next slide. There could be some implications under the ADA in terms of disability accommodations that might need to be made. So this is an early example of how those laws don't always line up 100%. And you have to kind of think about, how does HIPAA apply? How does the ADA apply? So that's how we go through these analyses. The next 2 categories, activity-only programs and outcome-based programs. There are special rules if your program is one of these 2 types of programs. There are essentially 5 requirements under HIPAA that you need to satisfy in order to be an acceptable wellness program. Okay. The non-discrimination safe harbor requirements. Okay. So these are those 5 requirements that I talked about. Reasonable design. This is a very basic standard. The program must be reasonably designed to promote health or prevent disease. Well, what's reasonable? Is it backed by scientific studies? What are the physicians recommending? That's what to be thinking about in terms of reasonable design. Other aspects of that could also be, what kinds of requirements are imposed on the individual? Is it reasonable to ask somebody to do what you're asking them to do? And we'll see that take on some different aspects as we go through this. The frequency of the reward. The basic requirement is that people, if you're providing some type of financial reward, people have to be able to qualify for it at least once per year. Usually employers will do that as part of open enrollment and have it effective for the whole following year. But if you want to allow people in, mid-year after they comply with something, that's allowed. Okay? And you can do more frequent. You could do a quarterly program. The amount of the reward. Generally, you're capped at 30% of the total cost of coverage. And that is calculated by looking at both the employee and the employer portion of the coverage. So employees might only be paying, say $100 a month for their premium, but the actual cost of coverage is $500 a month. So that $500 is what you use to determine the maximum reward amount. There's a special rule here that talks about if you have a tobacco cessation program, you can bump that reward up to 50% as long as the difference is tied to the tobacco cessation program. Uniform availability and a reasonable alternative standard. Okay. Similarly situated individuals need to be treated the same. And what that means is, if somebody can't do something because of a health factor, you have to give them an alternative. And depending on if the program is activity only or outcomes based, you might have to allow for waivers and that sort of thing. I don't want to get into all of the technical details. I can provide you with more background information if you need it, but basically a RAS, or a reasonable alternative standard, is what we're talking about here to level the playing field effectively. Okay. The last one is notice. It doesn't do any good to have a wellness program and give people alternatives if they don't know about it, right? So you've got to provide adequate notice. All right, tobacco cessation programs. So these have become very, very common. and they take many different forms. Generally, it's some type of, you can't use any tobacco products, and there'll be a really broad definition of tobacco products. Questions start coming up about, well, does that include marijuana? How do we handle that? Blah, 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 right? What we saw starting in 2024, there were a few challenges out there in 2023 and earlier years, but in 2024, literally dozens of lawsuits have been brought, many by the same small collection of plaintiffs' law firms, all saying essentially the same thing. These cases are ongoing. We don't have any substantive decisions on the merits yet, so we don't have any answers yet. We're starting to see some of them settle. And this is just one example of a case that settled just in the last few weeks. 5,000 employees, and they're going to be looking at getting about $580 each, which is about 30% of the financial reward that was at stake for them over that time period. Okay, that's a lot of money, right? We anticipate more cases will be filed. And in fact, I think part of why I didn't write any case names or statuses down was because it keeps changing so frequently. I didn't want to say the latest case because there was one since I started writing this. What do these cases allege? They all basically say the same thing. They're saying that just because future penalties are waived, well, yes, I agree. My future penalty, I can get that back, but I want the money for the first part of the year. Like if somebody participates in the cessation program and they complete the program in May, instead of just getting that surcharge refunded for June through the end of the year, they want the whole year. That's what these cases are saying in this first allegation. The next thing they're saying is that plan sponsors didn't give adequate notice, that people didn't know what they were supposed to do to actually get the reward. And then the last thing that they argue is, and this is actually an issue that's coming up in a lot of different ERISA cases right now, including on the retirement plan side, but they're basically saying the employer breached its fiduciary duties by taking that surcharge amount and reducing the employer's costs instead of putting that back into the plan and reducing the employee's costs, which is really kind of weird because that's not exactly what's happening. Like, you know, it's all sort of mushed together. The employer is still paying a whole lot of money for this. It's not like the employer is pocketing the money and going to, you know, the Bahamas with it, right? They're using it to provide other types of benefits under the plan. So I think of the three arguments, this is probably the weakest one, but right now the judges don't want to dismiss it because they're very cautious about anything related to ERISA. It's like, oh, it's an ERISA case? Oh, I'm not sure about that. We're going to give the participants the benefit of the doubt. That's sort of what happens right now. All right, quick update on the Macy's case. The Department of Labor sued Macy's for their tobacco cessation program. Macy's has been fighting this for 7.5 years, okay? They really don't like what the department is saying. The department is saying you didn't offer a reasonable alternative standard. And Macy's is saying, unless you actually quit, there is no reasonable alternative standard. And if you asked a physician would support us and say, the best thing you can do is quit. That's probably a little bit of an exaggeration because I'm aware of some situations where there's some exceptions that have been made there, but that's what they have been arguing historically. Most recently, this is your cocktail party chat right now, okay? Like you're reading these headlines about Loper Bright and you're like, I don't know what Loper Bright is, but it sounds really important, okay? Well, this is what Loper Bright is about, okay? There was a case called Chevron, and Chevron basically said when courts are evaluating a regulation, they have to give deference to the regulation. The agency that published that regulation generally knows what they're doing. They're the expert. They've gone through this whole rulemaking process, getting public comments and stuff. They are the experts. We're going to defer to the regulators. Loper Bright says, nope, you don't have to defer to the regulators anymore. When you're evaluating the regulation, yes, you respect the delegation, but you also have to make sure that the interpretation is within the scope of what that agency is being empowered to do. So if the agency doesn't actually have the power to issue that regulation, or their interpretation is inconsistent with what the statute says, then you don't have to follow the agency's thinking on that issue, okay? So Loper Bright happened in the summer. And since then, pretty much every lawsuit involving federal litigation is alleging in some way that Loper Bright doesn't, that Loper Bright is a basis for challenging that regulation, okay? We're seeing it very mixed right now, whether or not that will actually, support a challenge to the regulation, in part because this part here that I highlighted on the quote, when there is delegation to an agency consistent with constitutional limits, the courts must respect the delegation while ensuring that the agency acts within it. So it's actually a little bit more blended than what some of the headlines say. So who's going to win this one? I don't know. Maybe in another 7.5 years, we'll finally have the answer. In the meantime, a couple of thoughts on the current litigation environment and what does that mean for your wellness programs, okay? First, this is a good time to do a full body checkup, right? Kick the tires on your wellness program. Think about all those different laws that apply, especially the HIPAA rules, and make sure that it's consistent. Now, one of the things here, I'm going to actually go back. Remember what I said here about this first point, that the entire year's penalty should be waived, not just future? That's my first bullet point here. There's a DOL FAQ that very explicitly says you can do what all of these employers are doing in these cases. Okay, so why is that being challenged in court now after these regulations have been around? This particular FAQ, I think, is probably at least 8 or 10 years old, right? So why now? Might be Loper Bright. Might be the fact that plaintiffs' lawyers in the ERISA space have these huge war chests as a result of all of these other retirement plan settlements. And so they're going after the next big thing. Tobacco cessation litigation is the next big thing, guys. Okay. Look at your plan and your program, all of your written terms, what is in your SPD, what's in your open enrollment materials, what do people know? Think about reasonable design. I mentioned this at the beginning. What's the scientific evidence that supports that particular design? Is it reasonable to ask people to do what you're asking them to do? And think about it from your own perspective, but then get 4 or 5 other people in the room and ask them, well, would you do this? Would your mom do this? Would your spouse do this? Think about those kinds of things. Reasonable alternative standards. This is a facts and circumstances determination, okay? There's a bunch of rules out there about what qualifies as an acceptable RAS. So make sure you know what those are and that your alternatives check all the boxes. And then those notices. Make sure that those notices are accurate, that they're sufficiently comprehensive, that they're understandable by, average Joe and average Jane, right? Open enrollment materials are a big part of it. but also think more holistically, especially what's in your SPD and otherwise posted online. Retain documentation. I decided to start adding this just to make the point, in part because claims like this might not come up for years, right? And so you might have put notices together in, 2020 and 2021, and now all of a sudden in 2025, you get sued, right? So you got to keep track of those documents over time. That's really important. Think about those other laws. There is some overlap, but not everything is identical. In particular, under the ADA, we are still in no man's land on what an acceptable amount of a reward is. If you've come to these presentations in prior years, you'll remember some of the updates that I've given about how we didn't have any guidance, and then the EEOC just started suing employers because they thought it was wrong. And then the court said, well, no, you can't sue if you haven't given us guidance. And so then they gave us guidance, and then they changed the guidance, and then a court, there was a challenge to that guidance, and a court said, nope, you can't actually say that because all you did was look at the HIPAA rules and adopt the HIPAA rules. And the court said that wasn't sufficiently robust rulemaking, is effectively what happened there. So we're still in no man's land on the ADA. And I don't think that's going to change anytime in the next 4 years. I'll get to that in a minute. The ADA may require a disability accommodation separate from the RAS. So make sure you're thinking about that and evaluating the unique circumstances of a particular individual's situation when they come to you. Be alert for the plaintiff's trolls. They are out there. I've already seen in the last 2 months an email from an employee's spouse. It was allegedly an employee's spouse, but the way it was written, they had legal help getting that written. So be alert, look for those emails, make sure your teams are on high alert, and don't just fire off a response. Pause a minute, say, thanks for your question, we'll look into it. And then look into it and really kick the tires. Is my program doing the right thing? Where's my exposure? How do we make this right? Because if you can cut it off before that person has a reason to go back to the plaintiff's lawyers, that would be a good thing for you. Okay. All right. Oh my gosh. Expect the unexpected. This is really what it is, right? Okay. Those of us from the Midwest, when the weather's bad and you don't like it, and they say, just wait, it'll change. Well, that's kind of what's happening in DC right now, right? I mean, literally in the last 24 hours, we've had an order telling all of the agencies, stop funding all programs. And then a court said, no, the president's executive order is not going to be enforced. And then literally a couple of hours ago, President Trump came back and said, oh, I've reconsidered and I'm withdrawing that order and funding can resume. Are you sure? I mean, expect the unexpected is all I can say with any certainty right now. A couple of things. There are 4,000 political positions that need to be filled. 1,000 of them have to be confirmed by the Senate. You've heard about how many in the press so far, right? Like maybe a dozen are already, either confirmed or close to being confirmed and hearings being held. So we've got this parachute team concept, right? And so all the agencies right now have temporary leadership. Some of those temporary leaders have agency experience. Many do not. So they don't know what they're getting into. So it's going to take a long time for things to get done. That's at this point in time is just, that's the warning. Republicans have very slim majorities in the House and the Senate. In the Senate, it's 53-47, meaning that the Republicans can only lose 3 votes before they go to a tie break, which in theory they should win with the vice president being Republican. But you don't want to have to go there if you don't have to. But what that means is it's going to be hard to get things done, right? Couple of other things. We do have a nominee for the Department of Labor, which is going to impact everything that we're talking about today with the wellness programs. Her name is Lori Chavez de Ramira. She's formerly from the U.S. representative to Oregon, from the House rep to Oregon. She still needs to be confirmed. This is becoming a little bit controversial because there are some Republican senators who are questioning her appointment because of her historical support for labor unions. A big part of what the department does is regulate how unions organize and how employers interact with those unions. So not clear that that will go through. Not clear what her other priorities will be in terms of benefit plans. One of the things we do know is that tax reform is going to be a big priority. I keep hearing rumors that, the nice exclusion for employee benefit plans, like the fact that you get medical coverage and you don't get taxed on the value of your medical coverage. Remember that $500 a month that I talked about? Imagine if you start getting taxed on $500 a month because we lose the exclusion for medical coverage. That's what that second to last main bullet point means there. Tax reform, in order for them to pass the, reductions in rates that we're anticipating, they're going to have to find money somewhere else. And so benefit plans might be where they look to make up the difference. So just be aware of that. Okay. Early executive actions, we're seeing a lot here. The typical ones have come through. The main one that you always see on day one is any regulation that is currently in process is paused, okay? So all of the agencies are basically told, stop what you're working on. We want to take a fresh look at it, make sure that it's in line with our priorities and our planned legislation, et cetera. So that regulatory freeze is out there right now. Anything that is already final is not going to change unless the administration goes through the whole process of proposing something new, getting public comments, and then proposing then issuing the final, right? So that whole regulatory process needs to take place before a final regulation actually changes. What could happen in the interim is we could see a change in how departments enforce those regulations. So it could be a kinder, gentler from an employer perspective. We'll see. Depends on who our labor secretary is. If she supports unions, maybe not so much. We'll see. That's what's happening in the administration. I do want to kind of get to a couple of these other things and make sure that we have a couple of minutes for questions. Privacy and security. On one of the earlier panels today, you heard about lives and kind of all of the very cool things that you can do remotely through apps, right? Like that just sends off all these privacy and security questions, right? That's just one example of why you need to be paying attention to privacy and security. There's like, your Apple Fitness Watch and everything else. All of those programs, be thinking about what guardrails are in place to protect that data. State privacy laws. So I mentioned genetic information non-discrimination. There's actually an Illinois equivalent of that. And right now there's some lawsuits that are claiming violations of that Genetic Information Privacy Act when employers take certain actions during the hiring process. So just be aware, even state laws could have implications for what you're doing with respect to your wellness programs and asking about things like family medical history. Weight loss drugs. I did a brief update on this last year. We are continuing to see these drugs being used in a lot of different ways. They're very high cost. The conditions that they are being approved for are expanding. So we're only going to see this more likely. One of the things that is starting to come up is many plans, because of the high cost, have excluded these drugs altogether, or they've excluded them except in certain circumstances. If somebody's failed first on certain other things, or for only certain conditions, like they might cover it for diabetes, but not obesity. So there's lawsuits now that are challenging those exclusions on the basis of disability discrimination. And at the heart of this is this question of, is obesity a disability? In the state of Washington, the law explicitly says, yes, obesity is a disability. Under the federal ADA, it's still a gray area, okay? It's not explicitly a disability. And the court cases that have looked at it have basically said, you need to look at whether there's an underlying physiological condition that is related to why that person is obese. That could change. The courts are always evolving, and there are some pockets, some smaller decisions, more limited decisions that might be challenging that. Okay, so just be aware, this continues to be an emerging area. Mental health parity. All right, for the good of all of us, I'm not going to talk about mental health parity. We're just going to ignore it. And, we can't do that. We can't do that. We can't ignore it. Parity has been around for decades, okay? The new thing with parity is that when you have a non-quantitative treatment limitation, something like prior authorization is required before you get benefits, or your plan has a network of providers that have to be used. Excuse me. Those are non-quantitative treatment limitations. How do you measure whether or not those are in parity, mental health versus medical surgical benefits? Well, in 2020, the Department of Labor issued a compliance toolkit, or a self-compliance guide, that gave us about 60 pages of guidance on how to do that. And they said, here's some help. We think this will be helpful. It's not required, but this is how we're thinking about it. Well, lo and behold, at the end of 2020, they passed the Consolidated Appropriations Act in Congress. And part of the CAA said, well, we're going to take this little part of that compliance guide and we're going to incorporate that into the statute. So now what was optional and what was the department's, guidance is now the law. And on top of that, Congress said, Department of Labor, you have to investigate at least 20 plans per year. And then on top of that, you have to come back to Congress and tell us, how did your investigations go? Are plans being compliant? That's a lot, right? And the plan sponsor said, hey, we are happy to do whatever, but we need to understand what that means. Well, we finally got proposed rules, and the proposed rules were really ugly. We got final rules in September, which are generally better. They're still very onerous. There's this requirement to prepare a written comparative analysis. And remember Cheryl's comment about fiduciaries? Your fiduciary has to certify that they've engaged a service provider to conduct that analysis and that they've monitored the service provider's performance in preparing that analysis. Okay. You have to look at both what the plan says in writing as well as how it actually operates, which means it's not enough just to say, well, we follow the same process when we're setting up the provider networks for mental health and for medical surgical. You have to actually demonstrate that your networks are comparable. And that means measuring things like how long is the wait time to get in to see a mental health counselor versus how long is the wait time to get to see your, I don't know, have knee surgery, right? So it's very detailed analysis. It's a lot of work. And the Department of Labor has been very aggressive in its enforcement, in its investigations. That's a teaser. We're going to do a 1-hour deep dive through the employer roundtable later in March. Happy to talk more about mental health parity there. And I think I've got like 50 seconds for questions. Do I get more? Oh, okay. All right. We got time for questions. All right. Who has a question for us? Yeah. Yes. So the question in line is talk more about the end of remote work. And one of the headlines recently from the new administration is that government employees are going to be called back to the office, meaning they're not going to be allowed to work remotely anymore. That is kind of complicated because in some instances, you know, the government employees are out in the community and they're doing things they don't really have an office to go to. So presumably it doesn't apply to them. There's a bunch of people who took those jobs because they were remote jobs. So there's probably a bunch of people who are going to quit now because of that. That's likely to have a significant drain on the experience and the talent in the agencies. And so if you're thinking about something like, you know, expertise in looking at a comparative analysis, if your best experts just quit because they can't work remotely and you have to train up a new person, you know, that from my perspective, that's a big risk because that new person is probably going to go down the rabbit hole on a couple of things because it's just so complicated, right? There's actually a benefit to us having expertise in those roles in some ways. So that's just kind of my view on that. Is it going to happen? Who knows? There's also an announcement that was made that, you know, encouraging people to basically quit and get full pay until September, right? So like basically getting 6 or 8, 7 months of full pay for doing nothing. And as a taxpayer, I'm like, really? Why is that a good idea? You know, a lot of it is about bringing the government to a halt. That's what's underlying a lot of this, right? So hopefully that answers that question. Any other questions in the room or online?
Is this the most exciting time in your career?
Well, in the sense that, is this the most exciting time in my career? It's exciting in the sense that I like learning new things and I'm okay with change. I'd like to catch my breath a little bit, you know. I would say it's comparable to when the ACA was enacted. And I can remember the day of the Supreme Court, the first Supreme Court decision on the ACA and whether or not it was constitutional. We were packing for our week-long summer vacation. And It was the last day the Supreme Court was issuing decisions. Like, you know this, they break in July for the rest of the summer. So we knew the last decision was coming out. So I'm sitting there trying to pack. I got the TV on, I got my laptop going, and I've got my iPad going, right? Because I'm monitoring different things essentially. And so, yeah, that was fun. That was exciting to see what was going on. A little bit stressful trying to pack for vacation at the same time and do 6 loads of laundry, but we got it done. All right. Anything else? One more right back there. Oh, sorry. And then we have to take another question from Cheryl, right?
I agree with that. But for all of the RAS guidelines related to tobacco, without a surcharge, what does that look like, if anything?
So the question is, for tobacco cessation programs, if there's no surcharge,
yes,
what does that program look like?
Yes.
Okay. So is the question,
what if any regulations still apply?
Basically none.
Okay.
Like if there's no penalty associated with it, then it's basically just, well, here, try to participate in the cessation program. We think it's good for you. If you're just encouraging and there's no mandate, then none of those rules apply and your risk is very, very low.
Okay. And do penalty and reward operate the same way when it comes to tobacco?
Excellent question. Do penalty and reward operate the same way when it comes to tobacco? The answer is yes. And it actually is the same way for all of your wellness programs. The rules don't care what the label is. You can call it a reward. You can call it a penalty. You can call it a surcharge. You can call it a premium reduction. Doesn't matter what you call it. If there is a financial amount at stake, those rules apply. Okay. All right. Good questions.
And yes, I do have another question.
One more.
And you've got 1 minute to answer it, so we can actually be back on time. We have seen the fiduciary lawsuits on the pharmaceutical drug category. We haven't seen any of it on the medical benefit side, unless it was a drug on the we won't account for biologics.
Mm-hmm.
Do you anticipate that's right behind it?
Yes.
Good.
Yes.
Well, the reason,
and this is why. Can I take that 30 seconds? Yeah. Okay. So drugs are the low hanging fruit because a lot of people don't like drug companies and drugs are so high cost, right? But when you think about what the actual costs are in your medical plans, drugs are just part of it. And there is a lack of transparency around pricing in medical plans. And a lot of laws have been put in place and things are coming online over the last 3 to 5 years that give plan sponsors more tools to actually evaluate cost, which is a good thing. And you should, as employers, be raising your hand and asking questions and engaging independent experts to kick the tires on your plan because they're coming after the medical plans next.
And when we say medical plans, we're talking really about the carriers, right? The health plans, the carriers. I think it's going to be hard for an employee to get the transparency needed to have that lawsuit. I don't know what it's going to look like.
Yeah, so that's where things are going to get tricky because employers are going to get caught in the middle because the way ERISA works is you can bring that breach of fiduciary lawsuit against the planned fiduciaries. To be a planned fiduciary, you have to exercise discretion. Setting up plan design is not a fiduciary act, okay? But all of the other decisions that go along with maintaining a medical plan are. So things like selecting who your vendors are and, establishing your network and all those other little decisions, those are fiduciary decisions, okay? We're now in a state where your PBMs, your TPAs, your insurers, they're all basically saying, we don't have any discretion. You're choosing the plan design. You're telling us how to run the plan. We're just running the plan based on what you're telling us to do. So we're not fiduciaries because we don't have any discretion. That's what they're trying to say, okay?
Well, but they're also telling a lot of employers it's not your data.
Yes.
And so I love that a few of the employers today talked about it's your data and this is what you need to do something about it. And I think a lot of our employer members have that right, but not everybody does. And they need to do that.
I think that's exactly right, Cheryl. And so it's your data. You should be getting access to that data and you should be bringing in, consultants and independent advisors to help with that.
And there are lawsuits that are going to come up if you don't get your data and know what that is from I see it. Where are they?
I'm sorry. I like taking questions. I should have given you more time for questions. I'm sorry.
Hi, thank you. I just wanted to kind of add to what you were saying with respect to our question. I'm also a benefits attorney, not at a law firm right now, and it's also a question for you. So I know that the ERISA Advisory Committee, they proposed something around some form of legislation to get directly to the carriers. So there was something out there about that, but now with the new administration, that's probably going to be gone. But there was an attempt to get the carrier based on the NQTLs, I guess you can say. The exact language was around clinical decision-making. Right. And the fear was, don't go to the doctors. They're making some clinical decisions. But how do we get to the insurance carrier? So that could turn into something. I don't know if you think it could, but I think they're trying to get around the carrier or the vendor saying, I'm not a fiduciary, right?
I think that's exactly right. I think there's been a dozen or so cases over the years that have brought up this question of, is the PBM, is the carrier a fiduciary? There's some tidbits there that we can use as a basis to argue in some circumstances they are fiduciaries. But I think until we have legislation making it crystal clear, I think it's going to be an uphill battle. And whether or not that legislation comes soon, I don't have a lot of hope for it in the next 2 years in particular.
And there's going to be barriers put in place by them and other stakeholders. Yeah. Let us thank this fabulous woman for all of that great information. Thank you so much, Sarah. And I'm real quickly, 30 seconds. Uche, raise your hand. Uche is working with us on some diversity, equity, and inclusion information that has been happening for quite some time. Our sister coalition, Pittsburgh Business Group on Health, has created a DEI toolkit for employers. So we're going to have her do one of our upcoming employer-only roundtables. So you can bring your questions on that. And now I'm going to pass it over to Paula.
All right, we're just going to do a very, almost face planted there. Okay, a very, very quick energy break. So I'm going to have you guys stand up. We've got a very energetic speaker coming up. So let's get some oxygen to our brains. If you have high heels on and can slip them off easily, go ahead and do that. If you've got boots or, whatever, I know it's not possible, but so in line with our theme for the day, we're just going to do a very quick 30-second mountain pose and 30 seconds each side, little baby tree, okay? Because it goes with the theme of the morning, right? So for mountain pose, Samantha Clark is our newest MBGH team member. She's going to be our demonstrator of these poses. So stand equally. We're going to start at the bottom with our feet, equal distance apart under your hips. So balance your weight between both feet, kind of shift back and forth, and then you'll find your center. You want to feel the weight in all four corners of your feet. So big toe, pinky toe, both sides of your heel, right? You're not rocking out, you're not rocking in. Balance. Moving up, you want to pull your quads, lift your kneecaps, not hard, just gently, kind of just to engage your quads. Up to the belly. Pull your belly button in. That's going to engage your core. Okay? Moving up a little further, your shoulders are going to roll up and back, lift, open. Both palms are going to open and face the front. And now lift your chin just a little bit. Pull your ears back over your shoulders though. So you're not jetted out, you're back in. And think about a string pulling up to the ceiling. So you're as tall and long as you possibly can be. If you're comfortable, you can gently close your eyes or just gaze forward softly at something. Take one deep breath in through your mouth. In through your nose. Exhale through your mouth. One more time, noticing the balance, the strength, and the stability of this mountain pose. You are strong like a mountain. In through the mouth, out through the nose. Oops. All right, gently open your eyes. Okay, we got 30 seconds for each side. So now you're going to shift your weight into your right leg. Okay, think about growing roots down from your right foot into the ground, still balanced. On your left foot, gently lift your heel, toes stay on the ground. Turn your knee out to the side, and your heel is going to connect into your ankle. So you can pull it in, and knee is pulling back. Again, think about your tummy, your belly button's pulling in, you're stable. Hands come center. You're going to grow your branches up tall and long. Spread your limbs. Give your limbs a little wave. We've got a little breeze with our tree limbs today. Breathing in and exhale. Hands come down to center. Knee comes front. Place that foot down. Okay, now root into your left foot. Right heel comes up. You're on your toes. Turn the right knee out. Heel connects to the ankle. Hands are center. Deep breath in. Grow your limbs nice and long and tall. Reach up. Wave your limbs. You're such a strong, balanced tree. One deep breath in. Exhale, hands come center. Knee comes front. Step that heel down. Rotate both ankles. And you've done your mountain and your trees for the day.
All right. I am so excited about our last speaker of the day because I got a chance to meet her at the Integrated Benefits Institute conference here in Chicago in September. We saw each other across the room, didn't know each other at all, felt an immediate connection, talked, and before you knew it, we were good friends. And then I learned that she was one of the keynote speakers at the conference. And when she shared the topic that she was going to talk about, it really resonated with me because I was a caregiver for both my father when he died from Alzheimer's and my mother when she passed away 25 years later from dementia. And then she took us through an exercise that I think we're going to go through again today that made me realize I'm a caregiver for my family today. My daughter, her partner, his son, and their baby together. And it made me cry. I turned to Paula and I got tears in my eyes because I don't see myself as being that person, but it really empowered me. So I hope you all walk away with some new information today. Alex Drain is a co-founder and CEO of Archangels, a women's owned platform that engages and supports caregivers across all 50 states through partnerships with employers, consumer brands, health plans and systems, communities and states. She believes communities are the forefront of health, that caregivers are our country's greatest asset, and that we need to expand the definition of health to include life. Her photo comes from her genuine love of humanity, finding people interesting and wanting to know their stories and how we can impact their lives. As I told you, I had the pleasure of meeting her. Is that your photo? Is that you? Or is that just a pretty photo? Oh, I guess you have it. There's the photo. Let's welcome Alex and be ready for questions when she's done.
All right. So in closing out, I was hoping to share some of the key takeaways from our table talks, but we want to get you out of here on time. So what we are going to do for this learning event, as well as upcoming learning events, is put together a 2 to 3 page summary document highlighting some of the key takeaways. So we're going to use some of your comments in that takeaway document. We want to hear from you. We want to hear what you thought of today's program. So I'm going to ask if you can just take 90 seconds to give us some feedback. And the way you'll do that is on your phone. If you go to the MBGH app, there is a evaluation card And Lori's going to play us some tunes. And when the tunes are done, we're going to give out some prizes. All right. Thank you for giving us that feedback. If you're not done, feel free to just keep typing away. I want to remind you, however, of some upcoming programs. So on January 31st, which is this Friday, our early bird registration for the annual conference ends. So please take advantage of that. You're going to save a few bucks by registering early. February 13th, we've got our employer-only roundtable. March 4th, we'll be back here. March 4th, we've got a webinar on CGM technology. March 18th, a webinar on vaccine confidence. And March 26th, we'll be back here for our mental health forum. Before we give out prizes, I do want to mention that Alex is going to be hanging out for a little bit after today. So if you didn't get a chance to ask a question or if you want a little more information, she's going to be here for us. So now's the time we've been waiting for. We've got some great prizes and we've got some winners. So if Mindy, you want to come on over, I'll let you know who wins, and Mindy and Paula will get it to the right person. So here in person with us, the mini Theragun from One Medical goes to Julia Zamet from Metra. Congratulations. All right, and from Personify Health, we have a $200 Uber Eats gift card. That's a great one. Margarita Camilla with ReaderLink. I probably just totally crucified that name. From Trestle Tree, a $200 Home Chef gift card goes to Lisa O'Brien from H something Hava, Hava. An Amazon gift card from Lives, Daniela Kubelik from Sure Incorporated. This looks really cool. There's a Hatch Restore 3 alarm clock from GoodPath. I think I need one of these. It goes to Rosie Monosaurus at the Boeing Company. Yay. Airbnb gift card from Color Health. Goes to Jane Swift from AbbVie. And I think we have one virtual winner as well. Or maybe not. All right. Oh, I'm sorry, from Trestle Tree. A $200 Home Chef gift card goes to Lisa O'Brien. Oh. At Happy. We already did that one. I think we did. That's all, folks. You know, we thought we perfected this process, but you know what? We've never quite perfected it. All right, we have one more prize, and Mindy is going to go pick the winner. It's a mini Theragun donated by Hinge Health. Yeah. All right, and yeah. So just in closing, you know, when we do these events, we are really hoping that you have some actionable items that you can take home with you. And that's really our goal. And when we send you our document that highlights some of these learnings, hopefully that will just kind of jar some thoughts about what we talked about today. But in addition, we hope that you've also learned a little bit from our different speakers. We hope that you've made a new friend. I saw a lot of you chit-chatting with each other and conversing with those at your table and out in the exhibit hall. And we hope you learned a little bit or discovered a new product or a service from our vendor partners that maybe you weren't aware of. So if we did that today, it's been a successful event. We have another prize to give out, and the winner is?
It's Therese Riley from Consumer Products. She's virtual, so I will send you an email tomorrow and you have won the mini Theragun. Congratulations. And thank you all for coming.
Thank you. Be safe. And hopefully we'll see you back in March.